Good morning, good morning. Happy Saturday, Sunday. Lord, I wish it was Saturday. Good morning, everybody. Happy Sunday. Welcome in, welcome in, welcome in. Just tap the screen so we can push this live out this morning. I hope everyone. Hey, Trees. Hey, Rennie. Good morning. Y'all heard me say happy Saturday. This weekend went by so quick. So quick. Good morning. Hey, Trees. Trees, I thought about you yesterday, girl. Good morning. I went shopping yesterday. Honey. Honey. Good morning. Good morning. All right, Chelsea. Chelsea, I'm going to bring you up. We're waiting for Tiffany.
Rise and shine. Good
Rise
morning.
and shine.
Oh, I didn't get my other drink. Hold on.
Ma'am, y'all listen.
Oh, hold on, let me see. There we go.
I be
Good
commenting
morning.
on,
Good morning.
good morning, girl. I be commenting on Chelsea stuff.
All right, there.
Look,
Let
I
me
know
turn this.
somebody asked, "Are you going to ATL?" Now y'all know Kim is pulling up in ATL. Now that is
Somebody
Should I go?
that is a given. Okay,
I haven't
yes.
decided yet.
Decide now. Decide now. Okay, because it is going to be a whole moment. It is.
Yeah,
It
I was
is.
having FOMO last year, so I definitely should go.
Yes, I'm telling. Yes, I'm gonna be. I even told my husband I'm there because that's his weekend of his birthday. Yes, ma'am. I will be to ATL. I'm ready. I'm looking.
Tell him to come too. Tell him to come on. We will definitely celebrate his birthday. Okay,
Listen,
we'll do it.
I asked him if he wanted to
Period.
come. He said no, and he on the GLP one.
A mess.
Oh, so
I
he
don't.
needs to come.
I think he
That's all
just
the
sees
more
it.
reason.
I think he just
Right.
sees it as a weekend, like for me and my friends. His cat's going.
Mm,
So I'm gonna
I
leave
get it.
work. Yeah, I'm
Yeah.
leaving work that Friday in scrubs again.
Let me go.
That's been a 3 year in a row thing. I'll leave when I come to Atlanta. I leave in my scrubs.
Mm-hmm.
No, ma'am.
So
Hey,
Dr.
Blakey.
Angelina was trying to see if, and I don't know if you can do that or not with the, because she scheduled a live on hers too. So she was trying to see if she can co-host. Can you see that on your side? Because I told her I didn't think that you could, but I said we'll test it and then we'll get somebody to run over there and let her know if it's not working.
No, I don't even know how you do a co-host. I'm not even gonna lie to you. How do you listen? Where's Jay at when you need him?
I
Um,
think
Where is?
I think she would still have to request though.
Yeah,
yes,
she's gonna try to. Is Kat in here? Let me see if Kat can go in
I
there
do
and
have.
tell
I
her and
do
see if
have
she
it
can do
set.
it on her side.
I have that feature on allow co-host, so maybe she just have to request.
Yeah,
I
I
don't
think
Okay,
you
know.
can just.
let's see if she can then. Was Kat in here? Because I thought I just saw her in her live too. I'm not sure.
Hey, Blair. Hey, sister. Thank you for the gifts.
Hey
Talk,
Blair,
keep talking. I gotta take my menopause medication.
how are you? Good morning, everybody. Rise and shine. Is
Welcome,
Kat in here?
beautiful.
Has
Who?
anybody seen Kat this morning? Is Kat in here?
Oh, I'm not sure.
I
I
didn't go
don't
on my
know.
other. If not, I can go grab my other phone.
Someone said I can let her up if she requests.
Okay.
If she requests, yeah.
Mama, who
Let
y'all?
me see.
Happy
Hold on. Let me
Sunday.
go. I don't see Kat in here. Let me go see if I can get my other phone. Hold
Let me text.
on.
Okay, let me tell you something. GLP one is important, but menopause medication for them hot sweats is more important. Okay,
At least they figured it out now, you know?
ma'am. Y'all, the struggle is real. So once we get her going, Chelsea, first of all, I do see your stuff. You're so bubbly and I love it. So positive. So yes, when it comes across my timeline, because TikTok has been acting up, I
Girl.
wear my patch. I don't have a patch, baby. I got Viota, but if I miss it and I'm drinking coffee, it would not be pretty on this live.
Mm.
Brian.
We need all the things. We need all the things. All right, hold on. I found my other phone. Hold on. Let me see if I can send her a message really quick.
Y'all, it's beautiful. I'm in North Carolina. I'm from Maryland, but I'm in North Carolina right now.
What part?
I don't know what part.
She said, I don't know what part.
I don't even know what part we're in.
Are you
I just
living,
be going along for the ride.
are you living there or y'all just there for
No, we went to a car event.
Girl, I
Oh,
live
wow.
in South Carolina.
Really? Oh, wow. I think we're like, we went through, what's it called? The one that starts with the F.
Fayetteville?
Yeah, we're near there. We're like 20 minutes from there.
Okay. You like 3 hours away from me. Yes.
Oh.
I went to Charlotte yesterday, and if the young lady that saw me yesterday in the mall, like she kind of like, I want to say hi and thank you for coming up. Okay. When she was like, hey Kim, I was like, yeah, who are you? And it wasn't like that. It's not like that when I'm out. I don't want to say this and it's coming off wrong. I'm blessed to have followers. I really am. But when you notice me, if you say, hey, Kim is like a nickname that only my family members know. So I got to sit here and think, do I know you from school? Do I know you from the military?
Like, where do you come from? That's definitely how
So
we
I
born.
thank you. She was like, but you're so nice. I said, thank you. Tell the people that because, we
Tell the people that.
because we were smelling perfume and she was eating and she said, I had to come and say hi. So I don't want anybody, if you ever run into me, think I'm rude. You got to be like, I follow you on TikTok because I'm going to sit here and be like, where do I know you from? But I'm very humble. Thank you for coming up. Yesterday, appreciate it. I know she probably was like, girl, had 50 smells around me at that time because we was at the ALT theme. So thank you so much for like, I just want y'all to, even when I'm in Atlanta, like I'm really quiet, believe it or not.
Oh, wow, really?
Till I get a few drinks and then we all on 2-step.
There you go. And then it comes out.
So I hope you come, Chelsea.
Yeah, I think I'm gonna plan on it. I don't want to have FOMO like last year. Y'all were having a ball, so I was like, I think I'm gonna go. I think, is Blair still in here? I'll make my sister come too.
Yeah, I think she's still in here. Good morning, everyone. Tap the screen, please. Tap the screen, tap the screen. We're trying to get Dr. Angelina on. When Tiff comes back, we'll have Chelsea introduce herself. I'm coming. Brownie, we gonna see you, girl. Chelsea introduce herself, talk about her journey, where she's at. Today we're talking or discussing surgery. During your journey, after your journey, a lot of people are getting Dr. A is live. We're trying to get her over there, Pete. I don't know. I'm not good with lives. That's why I don't do lives. I get anxiety when I do lives.
I love lives, but I don't do a lot with other people, so I'm not that very well coursed.
I love doing it with other people. I'm
really, I'm
yeah.
like the opposite.
Good morning, ATL. I'm hoping to be there. Let me tell y'all something, Miss Francis. Girl, you live in the Bahamas, baby. You got the good weather. I'm gonna be there on Friday. I don't know what they have planned Friday, but I know Friday night I already got me a few lounges. I don't do clubs, but lounges I'm going to. I'm just saying. I already got my sneakers. I just need the outfit to go with my. Well, I don't know if the lounge is allowed, but some cute little sandals. I am there to 2-step my whole weekend away.
It's Friday to Sunday, but Saturday's the main event, right?
Yes. But see, I live 2 hours away. So
perfect.
I'll drive there. My friends that are flying in, since I have my car, unless you want to Uber, Atlanta is a scam. I'm going to tell you that, Chelsea. I'm going to tell you why. Let me tell you,
I bet.
I'm about to talk about y'all city. So last year I got a hotel. The hotel charged me $50 a night to park my car in the hotel parking lot. If not,
$50?
$50
A night?
a night. I said, wait a minute. Good morning, Jake. What kind of scam is this? And they were like, well, you can park it on the street. Well, you know what? $50 it is. So that was $100 Plus, no ma'am, no ma'am, no
Better
ma'am.
come with ballet, and they better come pick me up every time I come out of the hotel.
They had grits in the morning. They had grits. They had good. I mean, it was good, but everywhere you went, I spent more money. Y'all, we just trying to kill the time until we get the rest of the guests. Everywhere I spent more money on parking than I did food and alcohol.
Oh wow! So luckily, I wouldn't drive down there. Obviously, I'm from Maryland, so I'm on fly-in.
Fly in, save up for an Uber. Chris is in here, and that's why I have my hubby bringing me to ATL and then go back home. I'm not paying for parking. I mean, I'm not gonna lie to you. Blake, I get it, boo. I mean, I could have. Hey, fam, Chris, I could have spent on nice little drinks. Yes, Atlanta will drain your pocket. Right. I don't even see how people live there. I'm back.
Hey, Chris, what's up, Fridays fam? Oh, hey, Tiffany girl. Did we figure it out?
Okay, we're trying to see. I told Dr. Angelina to stop over there, make sure that everybody was still following her there. And then she's gonna try to. Hopefully she's
her.
coming.
I
You see her. You see her. Okay, we see her. Okay.
All right.
Ooh, we made it. We made it.
We did it.
I tried to go over to my other phone, and then my other phone cut this one off, and I was like, okay, well, we'll just come back. I'll come back in a minute. No worries. No worries.
Dr. Angelina.
Hi.
I haven't seen you since the first meetup. Well, I see you on here. How are you? How are you doing?
I have my breakfast, which is coffee and piece of cheese.
Yum.
The Breakfast of Champions, right? Okay,
Right. I'm
that's
drinking
it.
some water.
I mean, it's 10 o'clock, so.
Well, welcome in, everybody. We are glad we have been able to get everybody on here. We are so excited to have Dr. A, and we have Chelsea as well. We are going to start with some introductions first, because if this is your first time seeing Dr. Angelina and Chelsea, where have you been first? Okay, where have you been? And just be thankful that you have made it to the right side of TikTok today. So let's go ahead and do some introductions. I don't know if Chelsea already started her introduction or not, but we will start.
I waited for everybody.
Thank you. All right. So Chelsea, welcome to the party. Go ahead and introduce yourself.
Well, hello, y'all. I'm Chelsea. Chelsea loses this. I have pretty much over the last almost 2 years, about 19 months, it took me to get to 128 down. I've been on TERS my entire journey. So we're compound TERS over here. And pretty much after that, I was like kind of deciding on what I want to do with plastics. I am only 5 foot, nothing. So I started my journey at 282. Okay. Yeah, my ankles was crying. Okay. They was begging for help. Okay. And so then I got down to like around 154. And then I was like, okay, we got a lot going on here when it came to plastics, you know, being pretty much, I gotta watch what I say on here, like all my life, you know, so my body had taken a toll. There was a lot of stuff that needed to be done and still needs to be done. But ultimately, I thought about what I wanted to do. And I was going to get a mommy makeover, but then I kind of chickened out and I was like, okay, I'm gonna do it step by step. Cause like pain in me, you know, we're not always like, you know, now that I've been through my recovery, well, I'm still in recovery. I decided to get a BBL first for my first step, especially because I am only 29. I'll be 30 in April. Let's go. So I was like, in case of anything, I want to further my family, different things like that. I decided that I just wanted to do a BBL first. So that's where we're at. I'm in recovery about like 6 weeks. And yeah, that's me.
Nice.
Wonderful.
Congrats.
All right, Dr. Angelina, let's hear it.
Oh, you want to introduce myself? I thought everybody knew me.
I know, right?
Right?
Hello, I'm Dr. Angelina. I've been on this journey for about 26 years. That means how long I've been cutting people. Because a lot of times people like when you went to medical school in 2001. So I'm a general surgeon. I'm board certified in general surgery, trauma, critical care surgery, and cosmetic surgery. My practice does general surgery, bariatric surgery, which is weight loss surgery, and plastic cosmetic. We have several surgeons. So we have board certified plastic surgeons, both board certified cosmetic surgeons, board certified bariatric and general surgeons in the practice. So we're like one-stop shop basically for weight loss, whether it's medication or surgery. your hernias, your gallbladders, your JJs, your tubal ligation reversals, hysterectomies. I got GYN as well. Obviously all the aesthetic stuff, mommy makeover stuff, daddy makeover stuff. So we kind of like one-stop shop. And of course, we operate out of Atlanta, Georgia. We have 3 locations here and then 2 locations down in Tampa Bay, which means I fly every other week to Tampa.
Oh, wow.
Oh wow.
Did
While
not know
homeschooling my
that.
kids. Thank you.
Super mom,
Ooh.
super doctor.
I mean, clearly just doing it all, doing it all. And I knew about the one that was in Tampa too, but I didn't realize that you had to fly there, so frequently. So, but so we are excited to have both of you. Really on this live, we always get so many questions about skincare. We have a lot of people who are looking to do, like, they have made it to maintenance. They have made it to a place where they are now starting, kind of like Chelsea, like, okay, like I'm this close. What's going to be my next step? Or we have some people that are like, you know what? I've been here and now I'm still trying to figure out what is everything. Because I know for me, I hear so many different things and I'm just like, is that what I should get? Is that really like something that's in the cards for me? What does the recovery seem like too? That's probably the part that really scares me. But that's what we wanted to talk about. Like, cause I know Chris is in here, and when I told some people that Dr. Angelina was coming on, they were like, yeah. Well, we were talking about the meetup, and they were like, I wonder if she do some Botox, and I'm like, y'all, now come
We've
on.
done that. I've done
Right.
fillers and Botox on meetups.
Exactly. So I'm like, okay. But I'm like, is that something people need? Like, what does that look like? So that's what we want to dive into, of all the things around all of that. So my first question is for you, Dr. Angelina, is where do people start? Like when they really start to look at things about having any type of plastics done, what do they need to start? What are the basics?
So number 1, do not follow the trends. All right. 'Cause a lot of trends will lead you to chop shops. And the sad thing about chop shops, I know medical professionals that were signing up with things like Me Aesthetics, where there's no doctor operating. Okay. So number 1, if you don't get to see your doctor before surgery, like months before surgery, weeks before surgery, in some capacity, and they're just like, oh, you'll meet the doctor when you get there. Like, that's not a place for you, for anyone, really. Right? So even if I do a lot of consults with people out of state, right? So we will be talking on video. You're going to undress for me. I'm going to look at everything. We're going to discuss everything. If I feel like you need to lose a couple more pounds before I'm ready to do your surgery, if I need you to work out, right? Whatever lifestyle changes, like I'll be working with you. So that's why I tell people you can consult with me even 20, 30 pounds before your goal weight, because we'll make a plan, right? And then you have follow up again with me, 20 pounds later, and we're like, all right, we're ready. Let's schedule that date, right? So you have a doctor helping you make those decisions. You're not just on your own, kind of like blind kitten, like sticking your nose everywhere, right? The other places which I'm cautioning about, and I'm not going to say Miami by itself because those places are everywhere. They're not just Miami anymore. They're everywhere. The chop shops. They're the ones where you're going to be talking to a sales rep, right? You never actually get to see the doctor. And then like maybe the day before or morning of surgery, you're going to meet the doctor. But what if the doctor thinks you're not ready for surgery? And I spoke to those doctors. I know a couple of them who, like, after graduation, they're like plastic surgeons. So their names are on the websites. They work for those places because they have no other place, right? And they go in. Sounds good. Like they get good salary. They're like fresh out of school. They don't have to worry about finding patients. It sounds amazing, right? Like you don't have to do the hard work. And then they're like, patients might lie on their intake form. They're like, oh yeah, I'm 200 pounds, but in reality, they're 300 pounds. By the time they show up the day of surgery, they already put down payment down, right? And the doctor's like, I'm not comfortable operating. Like, I don't think I'm going to get them the good results. It's dangerous, right? Anesthesia risks, all this stuff. And the managers of that place will be like, don't worry about it. Just put your name on it, right? The techs will do the surgery. The surgical techs will do the surgery. Doctor is not even in the room. Whether they're comfortable or not comfortable. Like very rarely those doctors will cancel surgery because they don't have the say. So number one, find a place you trust. A lot of my regular patients, they know me. They basically like family by the time we get to actual surgical part. They're coming for facials, they're coming for Botox, they're coming for little thingies that we do, you know. By the time we start talking about surgery, it's like one of those, you know, in the office, I'm doing their Botox or girls doing facials. Hey, step in here, take a look at this. What are we gonna do? I'm like, all right, take it off. You know, so at this point, like we know each other, right?
Yeah.
A lot of my patients get to know us very well because we've been seeing each other for so long. And we're okay doing it by video as well. So I want my patients to feel very connected, right? Because then anything happens, you pick up a phone, you call and be like, hey doc, this doesn't look right. Right? So you don't want a place where you do not know the name of the doctor. I'm like giving you the whole lecture here because that happens. It's
They
real.
need it clearly, because now I'm shook on
I've
people that
I've
meet
seen
their
it
doctor
so
on
many
the day
times because we
of.
get patients coming in from those Miami places and whatever. And I'm not even mentioning Dominican or whatever. I'm talking about America, right? They're coming in from Miami. Okay, how long was your surgery? Like, you know, say a month ago, and they have like a big fluid collection needs to be drained. Nobody wants to touch them. You know, we'll let them come in, kind of like urgent care setting. So they have to pay for the visit, obviously. We do the thing. And like, who was your surgeon? So we can order a record. They're like, oh, I don't remember the name. I'm like, do we have amnesia? Do we have, you know, what's happening? It's only been 1 month. Like, you're going to remember Dr. Angelina if you're going to remember. Like, who's your doctor? Like, Dr. Angelina. I might not pronounce her last name, but I know it's Dr. Angelina, right? So, like, you have to know your doctor's name. Like, it has to be a relationship where you can easily talk to your doctor. If you're like, oh, I'm afraid to ask my doctor. Because a lot of people come on TikToks and they're like, I don't know if I should ask my doctor that. Like, just ask. What's the worst case scenario? I tell you it's stupid. Okay, whatever, don't do that. But you should be able to comfortable, like, have a conversation with your doctor about anything.
That's right. And I love how you said too, I mean, and I talk to people about this all the time, is like, you should be able to really talk to them like you're talking to your friend, talking to somebody in your family. Like, you have to have that best friend type of relationship. And especially if now you like, look, because Dr. Angelina's like, drop it. And I'm like, okay, wait, now hold on. Now I got to have a relationship like you my husband. Okay. We've got to be that tight. So I love how you said that. And I'm still really appalled by, you know, people. And I feel like that really kind of goes to maybe like the desperate side again of, I just want this done and I will get it by any means necessary.
That's
So
the dangerous part.
that's it.
I haven't seen a lot of those people super happy. Like the
Oh, I
high
bet
BMI
not.
tummy tucks. I'm like, look, if you're high BMI, we got GLP-1. If you're high BMI, we got gastric sleeve. You have the money to spend that much, get a gastric sleeve. It's cheaper than tummy tuck. Like, if that's the surgical route you want to go, right? So, but a lot of people come in, they just want it now because like their 30th birthday's coming up in April, right? So they want to be like, I want it now. So you want to like not think that way. There'll be next birthday. We want to make sure there's a next birthday. And if you do it a little too early, like if your BMI is 45 and maybe your diabetes is not fully controlled, or maybe you haven't like got your health, you know, in a better shape. And I'm not talking about perfect. I don't need skinny. Like if you're happy having curves, I'm not talking about that. I'm talking about like extremes, right? What are you in a hurry for? To look good in a casket? Like that's not what we want to do,
That's true.
right? But
Kelsey,
people don't
could
want to
you-
hear that. They don't want to hear the truth. They're like, oh, doctor's mean. I'm like, yeah, gotta be.
It's someone's
That's the
life.
thing called being real.
That,
not being real.
it's someone's life. You
Right.
know, it's your
And
life.
I tell them, like, I'm not making you look cute to look good in the casket. Like, I'm sorry, I'm not doing that. Like, I'm not gonna put my name on it. And you're not gonna be happy if you're doing it too early, or if you're not in a good shape, or if you haven't worked out. We're always talking about working out to building muscle, right? So right now you're getting ready for your next step, and you said you're not quite at goal, right, Chelsea?
No, I'm already pretty much at goal. I
Okay.
think that my recovery has gone so well because of the fact that I worked out. Like I was at my peakest fitness when I decided to get the surgery. That helped out a lot. My doctor even
Yep.
said, like, literally, you are in the best position to do this. Because obviously, you know, surgeries have been around forever and it's always like, okay, quick fix. But I truly wanted to make sure that I was literally close to goal, really at my peak fitness, because in recovery, I'm telling you that if I wasn't, it would have been 20 times harder. Like if I
Absolutely.
didn't have the arm strength I have, oh, I would have been going through it, you know? It truly does matter. And I would get to closest to goal like as you can before even starting. But I'm the type of person that I love fitness. Fitness is a part of me. So You know, I have been working out my entire journey, which made it even better. Because when I started my journey, I had high blood pressure. You know, I was on GERD medicine at early 20s, like so many different things. And I let myself take almost 2 years to get to the point where I was like, okay, now I'm ready for the next step.
That's the
which
right
is
way
super
to do it.
important. Yeah.
So if some people ask me like, what do I do before surgery to get ready for surgery? I usually say lift heavy shit, like go work out.
Literally lift
And
and
not
weight
just like walking in
training.
the park, I'm talking
Especially.
like training, like
Yeah.
go lift stuff. I want that muscle mass. The muscle mass will make your surgery recovery way better.
That's what I was about to say,
Look,
Dr. Angelina.
Dr. Angelina, that's some things in Chelsea, and I talked to Chelsea earlier about this too. Is like that's what I want y'all to really like kind of horn in on, because that's a huge thing that a lot of people don't want to hear. Like when they talk about surgery, they're just like, just do it, and they don't think about the part that it's how we
No.
have to get there.
I don't want
Like,
the
it's
chicken
like,
legs.
A
Like the
lot of
super
people
skinny,
just
you know, like
think
the
that,
super skinny. And again, I need muscle. I don't care if it's a skinny muscle, if it's fat, like a big muscle. I don't care how thick you are. It's muscle. I want muscle.
And you can definitely gain muscle while on a GLP-1. I lost almost 130 and I've been still gaining muscle because it's just progressive overloading, training, and not just doing random things in the gym, actually getting on a good program and being consistent. You know, my biggest thing wasn't to be the smallest. I just want to be healthy and strong. And, you know, strength training will do that. And it doesn't have to be 2 hours in the gym. You know, I was a teacher when I first started for over almost 10 years. And I just fit it in where I can. 30-minute workouts, you know, 45-minute workouts. As long as you're doing progressive overloading and getting in enough protein, because that's 100% the most important. You know, strength training is where you're going to want to start now. A lot of people think they have to wait till they get to goal to start weight training. And I'm like, just start now. I was 282 in the gym, you know? And I think that's how my journey has gotten to be so successful, because yes, I have loose skin, but it could be worse. You know, I lost 100, almost 130, 128, and it could have been way more loose skin. But because I weight trained, because I made sure I get my protein in, it was way better outcome than, you know, it could have been, especially with me being only 5 foot, you know. So that's ultimately too why I chose a BBL before getting anything else, because there's so many things you can do, you know, there's so many things you can do, but you got to do what works for you. A lot of people are like, why could you do that and then get back on the meds? I'm like, because one, these meds help with way more than just loss for me. I have PCOS, you know, I'm at a low dose now because I'm in maintenance, and for lifer, because they help me with more than that, you know. And you know, being at goal or whatever, or getting to where your goal is, for me, this is going to be a lifetime journey. You know, this isn't something, oh, I just needed to lose 30. No, I was 282, you know? So you just have to find what works for you. And like she said before, I really love, do not follow what people are doing, because if I had just followed what everybody else was doing, I would go get a tummy tuck like everybody else does. But that wasn't in my plans. You know, for me, it will be probably down the line, because I am only 29. I have other things in store that I want to do before that. So I always say, like, just make a plan for yourself, because it really truly matters what you want. It doesn't matter what the weight loss community is doing, you know? So
well, you can really follow weight loss community, because, you know, if you followed the weight loss community, you wouldn't be on this medication in the beginning.
No, exactly.
A lot of people were scared of it.
I was gonna say, I'm never the type of person to follow fads, and I never really cared. I started this whole TikTok because I was just gonna prove if GLP-1s worked or not. You know, I was gonna be the honest truth and be like, you know what, is this gonna work? Because I done tried everything before. And then I sat down real quick when I learned, yep, they do work. So, you know, that being said, you know, that's why I always say you just got to figure out what works for you. And things change. Like I thought I was always going to get a tummy tuck first, and that was going to be my biggest step. But I was like, I've lost 128. I'm dealing with tailbone pain. I want a certain look for myself. So this is what I'm going to do for me. I don't really care what anybody has to say about it. So
gotta get the booty back.
Yeah, because I had booty. Okay.
So
the thing, wow. Go ahead, Dr. Angelina.
No, I was just talking about the name of the procedure, because a lot of people do ask that question. What's going to be the first one? I was like, I don't know until I see you and I talk to you, because some people start with arms, because a lot of people don't care so much weight in their arms. They lost enough weight and now arms are real flabby, you know, start like sitting there flapping away. So then they're like, well, I can hide my tummy, I can hide my breast. I'm still working on weight loss, but the arms are like really visible. We'll start with arms, right? Usually legs is the only thing I will leave to almost the last one. But everything else, it has to be based on personal decision
That's good.
with your
Yeah,
doctor.
definitely.
Because the doctor might say, yeah, it does make sense to make this one before that one. Sometimes that happens. But that's where you have a conversation with with the surgeon.
Yeah, I went back and forth with my surgeon about if I wanted a tummy tuck, if I wanted a BBL, but ultimately I was like, when we chose tummy tuck, we chose BBL just because of my choices in my future and stuff like
Right.
that.
What if you're gonna have
So
decide to have kids in the near future, and you kind of right in that
yes,
age group where it's not like 20 years away from now, you might have 10 years,
yeah,
I've done tummy tucks on younger people, like 18, 19-year-olds after they lost 200 pounds, because they're like, if I'm not gonna do tummy tuck right now, there'll be no kids, because nobody's seeing this, like nobody's getting here. So I can see for comfort level for some younger people, it may make sense. And they understand that whenever they're done with kids, if that happens, whenever that happens, they might redo the tummy tuck. But they're like, I'm 18 or 20, because we do bariatric surgery on younger people now. 16-year-old will do tummy tuck sometimes. And if they lost significant amount of weight, like that does not look cute for them. They're like, I want to go on a beach. Like, I want to look cute for the next 15 years. And then maybe at 35, I'll have a kid. But like for the next 15 years, I need to do something. So that's, you have to really individualize this approach.
Now, what is the difference there? So I know when we think about, we hear BBLs, we hear tummy tucks, and then we hear the skin removal. What is the difference there? Like, what is the process of a tummy tuck? Like, what's happening here?
What's actually happening? I wish I could show you videos. We cannot on TikTok. But there's a lot of confusion on terms because we're talking medical terminology sometimes, and sometimes we use just like regular words. Like tummy tuck is not a medical procedure. Right? I'm not going to record in my operative note, tummy tuck. I'm going to say abdominoplasty. I'm going to say abdominoplasty with repair of diastasis recti. Right? So number one, putting muscle back together is repair of diastasis recti. And technically, when we say abdominoplasty, we assume diastasis recti repair will happen with it. So people are going to say tummy tuck with muscle repair. I'm like, it's like coffee with coffee. Like you are saying the same thing to a surgeon ear, right? So tummy tuck assumed we're going to repair the muscle. That's why we're doing tummy tuck, is to repair that muscle. Then we're going to do skin removal, which a lot of people will refer to as paniculectomy. Paniculectomy, that sometimes insurance covers, right? Like you hear about that insurance may cover paniculectomy. That's removal of an apron that hangs, that belly apron, that overhang, right? You've seen that fold that hangs down. Insurances have their own criteria. The overhang has to go below your fupa. Like if you're wearing underwear, you're looking in the mirror, you don't see your underwear, right? That means the penis is low enough where insurance may consider paying for it. But we're just removing that overhang, like just that hangy part, right? We're not touching your belly button officially. We're not touching your muscle in any way. So you still get that mama belly, like if you've been stretched out before. Now, it might be different for somebody who hasn't had kids yet, right? But like those are the considerations we have to look at. So muscle repair is to give you flat tummy. For that muscle repair to be successful, we have to have flat belly to start with, as in the visceral fat is gone. So the places where I might say, even though your numbers look great, BMI looks okay, but if you're carrying all of your excess fat in your belly, inside your visceral fat, you're going to look like ball in a sock. Like if I tighten that muscle and that visceral fat gets squished, now you really look like that beer belly look, because now the muscle is tight and all that fat is still inside. Right? So that's where I might say, yeah, your BMI is 26, but I need you to lose more weight because like your skinny legs and then just that belly, like we need to go lower, like to BMI 21, 22 for me to even make that belly pretty. And for others, it might be completely different, right? So now muscle repair, skin removal. So in a proper abdominoplasty or tummy tuck, as you guys call it, we remove all of the skin from belly button to mons. Mons is that fupa area, the hair bearing area, right? Fupa is not lower abdomen. That's penis. Fupa is the place where the hair grows. the fat upper
Gotcha.
pubic area.
Mm-hmm.
We're gonna say that for TikTok purposes.
That's good. Okay. Look, I
Right?
like these explanations because I'm like, what is that? Okay.
Because a lot of people
I'm
refer
learning
to
today.
fupa and they point at the lower abdomen, which is
Yep.
that penis, that lower belly overhang. Fupa is underbelly overhang, right? It's a different part of your body. So we want to make sure, at least in my practice, that when I do tummy tuck, I automatically lift the fupa. So mons lift, we call it mons pubis, right? Mons has to be lifted. That means part of that skin that where hair grows will also be removed. I have seen doctors, that's another thing you guys want to look for in before and after pictures and talking to doctors, make sure they don't charge you extra for that stuff. I have seen people coming in after, aggressive weight loss and then tummy tucks, flat belly. So they did the muscle repair, they removed excess skin, they left the fupa. And then now it looks like you got something in your pants and it's not cute.
Oh,
So you
see,
want to make sure that
that's
fupa
about it.
is lifted.
Wow.
I've seen that. I've repaired them because they come in. I was like, what happened? They're like, that's how they did it. Or like they wanted extra $3,500 for the fupa lift. So make sure that's all included for surgery. So again, when I say tummy tuck, like when I give you a quote, when I say tummy tuck or abdominoplasty, it automatically includes muscle repair, your own belly button reconstruction. We're not cutting off your belly button unless there's like a lot of previous surgeries around your belly button. I cannot save it. Sometimes that happens, but for average person, your own belly button just repositioned to a new location. I mean, it's the same location, just like new skin. We'll kind of like lift the skin up, pull it down, and then make new hole and belly button pops through in the same place where it used to be, where it's supposed to be. So I'm not making new belly button. It's like your own belly button.
Mm-hmm.
Removing all of that skin below belly button, and do mons lift all at the same time. That's a standard abdominoplasty, right?
Mm-hmm.
And then we can add liposuction for somebody who needs it, because some people come in, they lost so much weight, or maybe they never gained that much weight, right? Because we do tummy tucks on people who never been overweight, just kind of stretched out from pregnancies and stuff like that. They don't need liposuction maybe, but we can add additional if we need to liposuction. Let's say liposuction of a little bit of the flanks to like really shape the flanks. Sometimes we can do liposuction 360. We can take that fat and transfer it to your booty, which is what they call BBL. It's officially fat transfer is the name of the procedure, right? So we have to first gather the fat somewhere, liposuction, and then we'll process the fat and we'll put it back. Most common area would be your booty, right? So BBL is fat transfer to the booty. Sometimes we'll put a little bit up here too, but different story. So those things are kind of like we can add it on. Do we have to do it? No, we don't have to do all of that other stuff, right? Also, it matters which state you go. Different state has different requirements. So, for example, in Georgia, it's what we're restricted on: disorderly eating and body image.
So,
Did I get restricted, or you guys got restricted?
yes, I just got that I got the
I didn't get
notification.
anything. Oh, you did?
We're not even talking about food. They've been doing that.
Yeah, I'm not gonna remove you. Keep going. I don't know. It just said remove. I'm not gonna remove Dr. Angelina.
I
just
can
got
come out and come back in.
Let's do that. The same time she got the notification, I got the notification, y'all. So
It's telling you to
Okay,
remove
fine.
me because
No,
I'm talking about
no,
fat and
keep
skin.
going. Keep going. Keep
Right.
going.
All
What
right,
I
if we
need
start
from
losing
you-
people, I'll come out and come
No,
back in. Because
what we need
otherwise,
to do is have everybody tap the screen, even though it's restricted. Tap the screen to push the live out. That's all.
tap and share, guys.
Tap and share.
Okay,
You're
you
not.
got
You're
it.
not
Do all the things. So
It's
welcome
been
in,
happening
y'all.
pretty much every live on me. So
I'm just like this.
I love it.
Lately, I feel you. Yeah.
I think we've all had it. We've all been experiencing all the things, and I feel like it doesn't even matter what we're talking about.
and
Like,
I didn't show pictures. I'm like usually like I used to be
Right.
able to show before and after pictures. I cannot show pictures anymore.
Everyone.
Last time I had arm, like before and after arm like this, no body attached, just an arm. Before and after, they restricted me for showing nude bodies.
So I will take this. Keep going, Dr. Angelina.
Okay.
We're not
that's been phenomenal. I know I've learned a lot. So make sure this is a great time for a dramatic pause. All right. Thank y'all. We appreciate you tapping. We appreciate you sharing it with your friends, because I know there's somebody out there who needs to hear this. All right. Who needs to hear from the great Dr. Angelina, because I know I've learned a lot. I have my notes over here. I'm just trying to prepare myself for when I do get there. The number one thing that I have already heard is you got to do the work. Let's do some work.
You got to do the work. You have to do the work.
Yeah. I mean, Chelsea has already talked about, how her recovery is, and we're going to talk about that some more in just a moment too. But we're breaking it all down. We're breaking it all down for you. So share it with your friends. Share it with everybody. Go ahead, Dr. Angelina.
So we talked about, tummy tuck we talked about skin removal. I mentioned liposuction. So state regulations. Different state has different regulations. So Georgia, we have regular regulations. And obviously it depends where you do your surgery, in the hospital, outpatient surgical center. If somebody takes you to office as in like awake surgery, that's all bullshit. I'm not even talking about it. So I operate out of outpatient surgical centers. They're certified surgical centers, so we can do our sleeves and hernias and everything else in there as well, right? Because going to the hospital usually is very expensive to do surgery, right? So we stay in outpatient surgical centers. I want to avoid hospitals at all costs. So we have our own regulations, which basically controlled by doctor. I'm not going to do stupid 10-liter liposuction on somebody who's 100 pounds because they're going to die, right? We have limitations that we know clinically what we feel safe doing. Because if you overdo it and you go too aggressive on certain procedures like liposuction or very humongous skin removals, patient may not do well and you have to put them in the hospital on ventilator. So in Florida, because they have so many chop shops, right? We talked about them before, where the doctor is not even involved in surgery, the tech's doing the surgery. And it's true, guys. I thought, I heard rumors, I assumed, no, I spoke to people who actually went to those places, and it's true. They made regulations where if they're doing liposuction, they can only do like BBL procedure type of thing. They can only maximum remove 4 liters. Now, again, I still have to be varied, because if you're 120 pounds to start with, you don't have 4 liters to give up, because there'll be too many fluid shifts in your body. A lot of that fluid can then go to your lungs and literally drown you from inside out. Like you can get pulmonary edema from really big fluid shifts, among other things, right? So it's still surgeon determination what we feel safe, but Florida has different determinations. Florida has 4 liters of liposuction, an outpatient surgical facility, if you're just doing BBL or just regular liposuction and throw away the fat. Or if you're going to do tummy tuck at the same time, you're not allowed to take out more than 1 liter. So over there, I'm limited. So even if I could do, let's say you plump enough and you have enough fat, and I could do I would want to do a full tummy tuck with liposuction 360, like going after your bra rolls and back and whatever else, right? I cannot do it in Florida, because if you have more than 1 liter of fat, that's like a useless procedure. In Georgia, I can. Where I have some patients like, maybe it's just easier for me to come to Georgia. I was like, maybe it is, because I operate in 2 states. But over there, I might have to do just like a tummy tuck and then bring you back as a second procedure for liposuction. So those things to consider, state regulation. And of course, if you're a surgeon going against state regulations, I would also question that, as in why are you not following state regulations, doctor? Right? I mean, I understand a little tweaky, like we can play with liposuction a little bit, like when we take the fat out and it goes in a canister and gives me 1 liter. If it sits there long enough, it will split. There'll be this much fat and this much fluid that I put in there. So I can say, okay, fine, take the fluid out and we'll just count the fat alone, not the fluid that I put in there, that numbing fluid, right? So we can tweak numbers a little bit, but it has to be within overall, you know what I mean? Reasonable, following the law thing.
Yeah.
And we all about following the law now. Because I mean, I would, and just like you said too about, I would feel, if I already know these things, I've done a little bit of research, and you're like, oh no, we're just gonna, start trying to cut corners. I don't want to cut corners. I don't want to cut a corner. So let's talk.
Clinical, there's clinical, doctors have to be able to use clinical judgment. I don't need like a robot staying over me, because that's what's wrong with medicine now. They're like, you cannot do it. I was like, bitch, I can do whatever I want if I feel like it's safe. I'm not going to hurt my patient. It's my license on the line. Right?
That's right.
But there's a little wiggle room in my mind for what we can do. But if it's like avert, like, oh, we're just going to ignore it, I'm going to go ahead and do full liposuction 360 and take out 5 liters and do full tummy tuck. Well, then, right? And you have to understand the law properly. Because I had some people come in like, well, you're not supposed to do it. I'm like, excuse me.
Been doing this.
I'll tell you what I'm gonna do.
22
Right,
years
so-
in accounting. That's right.
People, you know how some people try to read the law and just like go like this. I'm like, that's not what it means. Like, you also have to make sure people understand the law. But in general, I'm just talking about general. Also, the wake surgery situation. We talked about that.
I saw somebody
I
ask
talked
about that too.
Yeah,
Like,
what's
how
that
do you?
about?
One, what in the world are you getting
Is
done
it
that
safe?
you're awake? I'm like, wait,
I
what?
couldn't
So let's
imagine
get
being
into
awake
that. That's the
during
next
yeah.
level. You know, obviously there's many different surgery. I just kind of talked about tummy tucks a little bit. Obviously there's arm lifts and thigh lifts. Arms and thighs, go to somebody who does them a lot. I do. It happened. I didn't plan to. I was doing thighs. I did few thighs at the time. I didn't really advertise them, never posted them. Because a lot of doctors don't, right? You'll notice like most people will post breast and tummy, but they're never going to really put thighs out there. Why? Because it's not an easy procedure to do. It's a really easy procedure to fuck up. So clinical terminology here, sorry, language. But I did couple, I guess, good ones, and somebody posted on some of those sites, you know, the groups for the thighs, and next thing you know, people coming in like, I want you to do my thighs. I'm like, you haven't even talked to me. They're like, don't worry about it. I've seen your work. And I'm like, where? You know, I was so surprised. And then they showed me, I was like, you know, they showed me the page, and there were a couple of my people posting there. I'm like, I guess I have to advertise it. Like, I didn't realize people wanted to see that. So since then, it was before Corona, I've been doing much more, you know, thigh. And because of that, obviously, I got a lot of thighs coming in. Thigh is very tricky. You have to make sure, because people try to talk, you know, they give you, oh, no, just do liposuctional, never works. Oh, let's do a full body lift instead of thighs. Doesn't do anything to your thigh, right? So arms and thighs are very tricky. Make sure if you go to somebody, find a doctor who actually does them well, actually look at their before and after, right?
Are you awake during that?
Huh?
Are you awake during
Not
arms?
my surgery. I don't want you talking to me.
Right.
Me neither. That's the best sleep. Put me under.
I
So
feel like
let's go
that's
talking
a
about the
I don't know
wake
what you're
surgery.
talking to me. Oh gosh. I mean,
No, let me do
no
my
way.
job. I don't need to hear your ooh and ah over there. Like, no, please go to sleep. Now, where's the whole awake surgery happen? We can do awake surgery. I do awake face tight, you know, little face procedures, little eye procedures. I have done awake mastectomy on an 80-year-old male for breast cancer, right? I can do awake surgery when needed. Absolutely okay to do when, like, we have no choice, right? So when anesthesia becomes more dangerous for the patient, then whatever we need to do. So like that 80-year-old dude with previous like heart attacks and disease and, you know, 80, but he has breast cancer on his breast, right? Men can get breast cancer too. I did his mastectomy awake. That was back in the day when I used to do all that stuff. We injected enough numbing medicine. We did it, right? I had one 80-year-old guy who said, I don't have nobody to drive me do my colonoscopy awake. All right, I really want to. He did fine. Things can be done. Do you want to be awake for your colonoscopy though?
Okay.
no.
Do you even want to know what's happening? Or you be like,
I woke up in the middle of mine, so that's a no.
I mean, you wake up, you sore, we'll put you back to sleep because it's a sedation,
Yes.
it's not real anesthesia,
Yes.
right? So sometimes they keep you light and you get like a little wiggle in, we'll put you out again. But I'm just saying, I'm giving you examples. Can we do awake procedures? Yes. Do you want to? Like normal person? No. Now, where did the whole thing of awake surgery came from? When doctors realized that they can do surgery in outpatient surgical settings, when non-surgeons started to do surgery, right? So when you get family doctor, internal medicine doctor, ER doctor, anesthesia doctor, they're not surgeons. None of them are surgical, right? But they want to do like cosmetic procedures. And then they start learning how to do liposuction. And then they start, oh, I'm going to do some more, right? Dermatologists, they pretending to be surgeons, right? So all of those subspecialties that are not surgical specialties all of a sudden want to do this, right? They cannot get privileges in the hospital to do these procedures. They cannot get privileges in accredited surgical center to do these procedures. They cannot get privileges in a center that's allowed to do general anesthesia to do these procedures. Because by law, if you are accredited, your doctor is going to be board certified in the specialty, right? Doctors should be clear to be able to do this general anesthesia procedures. That means not every center can put you to sleep, right? Some doctors will do procedures in the office. They'll give you a couple of pills of something, and then like numbing medicine and do them in the office. They may even have anesthesiologists in a room giving you sedation, but sedation is not general anesthesia, right? So a lot of those doctors will do these huge procedures under IV sedation. They don't have the machine to intubate you. They don't have the gas that we use in anesthesia to run the intubated patient, because usually we give you IV, the propofol, which is the Michael Jackson drug, right? We give you a little bit of that. You go 1, 2, and then you're done, right? After that, we don't keep pushing the propofol in general anesthesia. We put a little tubey down your throat or right in your mouth, like a little mask in your mouth, and we push gas, a sleeping gas. And gas is what keeps you asleep during surgery. That's the safest way to do it. Not the propofol, because propofol after 45 minutes to an hour is very risky for your blood pressure. You can end up with propofol syndrome. I've seen a lot of it back in ICU because I used to be critical care, right? So I used to cover ICU where people could not keep up their blood pressure. I couldn't give them any medications to keep their blood pressure up. So we were just like trying while they're like there. And propofol syndrome is a scary shit. You cannot reverse, right? So what happens? All those doctors want to do surgery. They cannot get privileges to get anesthesiologists to do general anesthesia in their center, whether it's outpatient surgical center or office-based center. They cannot go to the doctor, to the hospital to do it. So they're like, we're going to do local surgery. We're going to do it under local awake surgery, right? So, if you do proper liposuction, a little area of stubborn fat. Sure, great. Let's do a little area of stubborn fat. That's how it started. But later on it progressed. Let's do the whole thing under local. Let's do the whole tummy tuck under local. Muscles, right? And then people show up with like literally PTSD after that.
Yeah,
I can only imagine.
I can
would
imagine.
pretty much have the same as well.
But that's where it started. So when somebody's really pushing awake surgery on you, major surgery, I'm not talking about like little touch-ups, little areas. Little areas are fine. But if somebody's pushing major surgery for you, or if you like, even if you're doing littler procedure and you're like, can you do it under general if I want to? And they're like, oh, you don't need it. But if I want to, can you put me to sleep? Do you have anesthesiologist there in case shit hits the fan to intubate me?
We need to
And
know.
the answer is no.
That's
You have to really look into that center,
Yeah.
That's good. Ooh,
right?
most definitely. Go ahead, Ken.
Dr. Angelina, someone asked in a question about insurance. So can you briefly discuss what insurance would or would not pay for when it comes to these treatments?
So I don't know all of those answers because I don't take insurance. I have tried multiple times. It just didn't work for me. Usually doctors that work out of the hospital, so like a plastic surgeon that actually works either for a large hospital facility or employed by them or operates out of the hospital, are more likely to take your insurance that may potentially pay for it, right?
Gotcha. Okay.
Why? If I do, I've done and I've lost. If I did, I've tried to do some breast reductions with like United Healthcare back in the day when I first started doing this stuff. Did all the paperwork, did all the measurements, did the whole thing. And they sent me a letter of the pre-authorization letter, whatever it's called.
Mhm.
But the bottom of that letter, it says the letter is not guarantee of payment. So I do the surgery, and I did it in my surgical center because we do have privileges. Our center was contracted with United Healthcare. But after I did the surgery, they didn't pay,
Yeah.
right? So then what happened? I did not just not get paid. I lost money because I paid my anesthesiologist. I paid my nurses. I paid for the supplies. I paid for everything. So it's not, I paid to do the surgery for somebody, right? So after a couple of times, I'm like, I'm not cute. If you operate out of the hospital, if I was doing the surgery, let's say in a nearby hospital, I have Piedmont system here, right? So if I operated out of Piedmont, I would just not get paid to me. I wouldn't have paid everybody else. The hospital will lost money, not me. And they got probably way bigger billing department that fights with insurances to get paid, because that's what you have to have billing department. That's like a whole army of billers to try to get you money, right? So you're probably looking for the doctors that work out of the hospital, or at least have ability to operate out of the hospital. you have to start planning ahead of time. So you call your insurance now. You tell them, hey, do you cover, resection or excision of excess skin after weight loss? They might say yes or no. Some of them will flat out say no. Like, is there any options? Like, we have issues, we have skin irritation, there's pain. They might say yes or no, right? If they said no, then probably no. If they said yes, okay, what are the qualifications? It gives you a whole list. It's usually a long list of stuff you have to do before they consider you for surgery. So some people who are really persistent might be able to get covered at least partially, but it could take like a year, right? Because if they say, first you have to prove that you have a problem. You have to, prove your sufferage, right? You have to suffer, as usual with anything else.
That's the truth.
You have to prove that you have suffered.
And that's a huge thing too. It really is, trying to deal with the insurance. And I've seen people go for, months and months. I had my first consultation. Now I got to go back again. And now they need me to do this. And so it can,
get that list.
I feel like that's a part of the plan too, that you talked about.
Get that list, right.
To them, and not only are you talking to your surgeon, you are starting to try to at least see maybe if your insurance will cover it. Maybe they will, maybe they won't. But if you don't ask, the answer is always no.
So you can get the list of this requirements, and you might not even get to the surgeon until everything on this list is completed. So list will be like, let's say if you have skin irritation, you have to show proof. So you always want to take a picture of that when the irritation is actually there, because if it gets better and you don't have that picture, you cannot prove it. They're not going to believe you. Obviously, that's their default, right? They have to sometimes say, that you went and complained about that yeast infection and the skin folds or irritation, and you got prescribed the medicine for it, the usual antifungal medication. And sometimes they say at least 3 times. So just have your doctor give you at least 3 refills, and you actually pick it up to show proof that you actually picked it up and you had treatment. If it's a weight loss related situation, so you now had that hanging belly, skin because you lost weight loss, they want to see picture that it's hanging below your fupa, like I mentioned before. Otherwise, it's not long enough. They don't find it significant enough to pay for. Then they want to say, if you had a weight loss, this is a result of weight loss, you maintained your weight for at least 18 months. So you're doing all of this stuff for so long while maintaining your weight. Right? So it's like the whole thing. So make sure you go document, like if it's a arm thing you're trying to get covered, you're showing that your shoulders hurt, that you're getting like something, right? So you have to maybe search on other, places. There's some people here that do those. There was the lady here, the Queen That Matters, her tag on the thing. I don't know if you guys met her. I think either she came or she wanted to come to some of our events. But she does, she charges people. I guess that's her thing. But she's supposed to walk people through how to get approved. But if you follow her, some of her lives, maybe, But there are people here that do that. They help you to try to get, navigate that system to help you get approved through some insurances.
Okay.
Perfect. So we have learned a lot thus far. We've learned a lot about the terminologies, and I know that I have, I hope y'all been taking notes, because I'm telling you, these are gems that, Kim is always dropping. Now we got Dr. Angelina. I want to switch a little bit and go to, because next we're really going to talk about some skincare too. But I want to talk about, before we leave this, around the surgeries, really around the recovery. So Chelsea, can you talk about what your recovery has been like? Because I feel like that's the wildest thing for me. Everybody knows my husband is a truck driver, and I'm gonna be here by myself, and if I gotta call mama, I just don't know about that. So can you talk some about that, what that looks like for you?
Yeah, so recovery is something that I was worried about too, because I am, I have a daughter, and luckily she's 13 years old. So she's very independent. She's homeschooled. So I didn't have to think about any of that situation. But when it comes to recovery, I really recommend people think about everything that it comes with it. Now, I got a BBL, so it's a little bit different than other surgeries. I can't drive. I can't sit on my butt, So the reality didn't really hit me until I was in it. I did my research. I knew everything that was going to happen, but it wasn't until like it actually happened that I was like, oh, okay, I really can't go anywhere, which mind you, I work from home. I don't really go anywhere anyway. So that's good. But if you do have a, like, you know, leave your house and you have to bring your kids to school, it's something that you're going to have to really morph and like prepare for. Now, when it came to pain, I don't know if I have a high pain tolerance or what, but I just wasn't in a lot of pain. My doctor also said it's because of my age and because of where I was, like in my fitness and different things like that, of why I feel like I bounce back pretty fast. But it was still, you know, something that I had to prepare for. And I'm still in recovery now. Like I'm still not sitting down, you know? So it's different things like that, but I'm like driving again and I'm working out again now, which that I feel like for me was the biggest part of like, you know, when you're in recovery, it can become really emotional. Especially like, I don't know. That was just me personally, because, you kind of think of recovery like, oh, it's going to be a couple weeks, but it's truly not, especially if your body's been through loss and everything like that, major loss. And then after that, doing surgery, it's like sometimes you won't just bounce back and you have to give yourself recovery time. After day 4, I feel like, well, after day 10, I felt like great, you know, but after day 4, I was kind of like, I want to work out. I want to do this. And I felt like I could, but you really can't, like, you really have to sit yourself down. So that was one thing I wasn't prepared for. I'm the type of person that worked out every single day. So not being able to kind of was like, where's my identity vibe? So you kind of have to prepare yourself for that. And like kind of just like work around it and have plans, you know, have plans in place. Luckily, I have a really good support team. My sister Blair, that was in the chat earlier, she took care of me the first 4 days, you know, so she's my older sister and having her was really helpful. I thought that I would need someone to like make me food, like help me use the bathroom. But like, it really wasn't like that. Like I was fine. I just was uncomfortable. I was more just annoyed. I did just get a BBL and lipo and that was it. So, you know, it could be different when you like have tummy tuck. Obviously it's going to be harder to move. But for me, it wasn't really hard, more just annoying. Like being in a faja, the compression socks. The compression socks. Y'all, I don't even like wearing socks, period. Okay. I literally was struggling with the compression socks. Stuff like that you just don't really think about when you're like, I'm just so excited for my surgery. Which, you know, granted, I was excited, but after I was like, what did I get myself into? Can't even sit down, gotta wear these socks, but like, honestly, it's all worth it. Like now being like 6 weeks post-op, I have like more clarity and I'm like, you know, it is all worth it, but you have to think to yourself if it truly is going to be worth it for you. Like if I had like a young toddler at home, like I don't know how I was going to be able to do that. My daughter, she's 13 years old, so she's good. You know, she's helping me out, you know, but like I can't imagine like having toddlers running around and then having to deal with recovery. So like making sure that you have like family members or like I have a big family, like my sisters were there helping me. I had friends helping me. I had a lot of people helping me when I needed it. Having that in place just in case is really good. And knowing that everybody's recovery is different. Like sometimes I look on social media and I'm like, oh, she's 6 weeks and she's doing this and she's doing that. That's one thing you can't do. You know what? I just take a step back and like, let me pray. Okay. Because at the end of the day, you know, I'm not going to recover like them. They might have had different situations. You know, you can't compare yourself. And that's one thing that a lot of people will do when it comes to recovery. So I really had to just like take a step back and realize that it is temporary. You know, a lot of it, we get overwhelmed because they're like, oh my gosh, this is our life. Like I'm stuck in a faja forever. You know, it does
seem like forever when you're wearing it.
The girlies literally label me BBL prison. Like literally, that's how I feel. I'm in BBL prison right now. Okay? Because it's literally like, it's a lot. But at the end of the day, it is worth it to me because I've worked so hard to get to where I am, you know. Being 282 at 5 foot was not easy. It took a toll on my body. So
that was a different kind of prison.
That was a different type of prison, 100%. So it's like I can't expect my body to just bounce back quick, and I have to give myself time. So that all being said, recovery wasn't really that bad. A lot of people, like even my doctor was like, oh, it's going to be like 20 times your C-section. You just have to prepare yourself for it. I think I was preparing myself for the worst. That's why when it happened, I was like, oh, really? I got this. You know what I mean? Like, I want to go lift something. I'm still mad I can't be lifting heavy right now. But you do have to
probably can by now. 6 weeks, you should.
Yeah, I'm back to working out now. Thank the Lord. So we're good. But like like after week 1, I was like feeling good. Like I was like, let's go, let's party. I want to do everything, but you kind of can't, you know. So I was like, let me sit down for a little bit. But no, that's really what it was. Yeah, you have to take your time and realize that it is going to be different from everybody else at the end of the day.
And
She
also
was,
different expectations from different doctors. So,
yeah,
because a lot of people are like, what should I do? I was like, don't ask me, go ask your surgeon, you know,
that's
because it's
another
different.
thing. Yeah,
I don't
like
know
one
what they,
surgeon can
I don't
tell
know
you
how they
that one.
do it. I don't know what their expectations are. They might put different limitations on you than I would based on our experiences,
Yeah.
right? And don't listen to TikTok people as far as I've had people like I've do a tummy tuck, but they go like, well, I was told to put this liposuction board into my faja and like kill a flap, kill part of the skin because like I didn't tell you to do that. Why did you do that?
That's another thing. Like, I get TikTok is so helpful. We love TikTok. We love her.
General
But when it
information.
comes to that, you need to be listening to your doctor. You need to be doing what's good for you. Just because one person said it doesn't make it the all in all. Everybody's journey is going to be different.
I need you to repeat that.
Okay.
So
No,
the people
literally.
For the
in
people in the
the
back and in the hallway.
and in the hallway, listen. As a medical assistant, when I come on here, the amount of like Dr. Angelina, if Dr. Angelina tells you to do something, don't come on here, Chelsea. Well, Dr. Angelina told me to do this, but I see that you're doing this. Listen to your doctor.
Your doctor, exactly.
That even comes with like these meds and stuff. I hear so many people on here saying certain things. It's like, no matter if we're doing the same exact thing or the same way, it's going to be different for everybody. And that's what people don't understand. You're looking at someone's chapter 47 when you're on chapter 1. Like, you got to start where you are, and you can't just think that, oh, I'm going to do exactly what you did. Even if you did, honey, you're going to have a different outcome. We are completely different people. I have to tell people that daily. I'm like, don't follow what I do. Okay. Don't
That's my
follow what I
pet
do.
peeve. When people are like, it's been 3 weeks and I haven't seen a difference. I'm like,
It's been 3 days.
Every single day. It's
how
been
about you give
48
it
hours.
another, I don't know, 12 months and then we'll talk.
I tell people
Right.
I do what's good for me.
Literally.
I hate when people ask me, what's your dosage? My dosage for me, for my doctor, that's my dosage.
Literally.
What do you call-
That's a provider
Oh,
question.
what's your favorite dosage? I was like, it's not candy, it's medication.
No, literally though.
It's not candy.
Listen, Dr. Angelina
I'm gonna start using that
and
one.
Tiffany, I had
Yeah.
somebody call me stupid in my chat because I would not give them my dosage.
But like, who cares? Because even if you feel that way on it, doesn't mean they're gonna feel that way on
Exactly.
it. But the
It
dosing
doesn't make
question
sense.
for-
But people like talking about this stuff, like, what's your favorite stack? I'm like, I'm gonna have a seizure just saying that word.
Yeah,
Like,
it's
we're stacking
dangerous.
underwear. We don't stack peptides or medications. Like, that's another thing. Like, just talk to
We
your
don't have to come back and have you talk about that, but I mean, you know.
Dr. Angelina, I had a question. I know I wanted to come back to this, but I'm gonna try because I know my time is limited this morning as well. But when you think about skincare, all right, I want to really touch on skincare of because we definitely thank you. And for those that were at the last meetup and you were able to, you know, in your swag bags that had things from Dr. Angelina, I'm still using mine. Okay. Like, I mean, it was good. I mean, there were some things in there. And I also went to the different places to look at some of the other things that you offer as well. When you think about skincare, like, and we always ask people this, like, where do you start? Like, especially for someone who has now, like, they're really starting to get into skincare from whatever. Now we are people who are in maintenance or people who are getting close and they're like, you know what? I'm not really worried about what the number on Bruno is even telling me right now. I'm focusing on this skin. I'm focusing on how I am enhancing the way I present. I am now presented to the world. Where do we start?
basics. Start. Number one, start.
Mhm.
Do
Start with
something.
washing your makeup off first. That's me.
So basics, don't overdo it. I know, again, on all the social media, it's so easy to get lost with like 25,000 thing. And I get lost. Like, I have a box over here of stuff that I haven't even opened because it was like look cute. I was like, I'm gonna buy it. What is it? I don't know what it does. Like, I have to go back to look like what the fuck I just bought. Right? And I don't even use that much. Like, I'm a minimalist. Obviously it varies from person to person and genetics. You know, you all dark melanated queen types, like you're gonna need Botox, whatever.
You might
We
now.
survive on Botox. So prevention, right? So number one, prevention. Your sunblock. Always, always, always. I don't care how dark you are. I don't care from which part of Africa you are. You need sunblock. Because right now it's fine. 10 years, 20 years later, you start having all those discolorations or start growing the little skin tags on the face. You've seen the dark ladies with the darker pigmentation coming out too. Obviously, different risk factors. You know, lighter skin more likely to get skin cancer, but the skin damage happens no matter how dark you are, right? So sunblock is always a thing, right? We can get our sunblock with tinted moisturizer. Now they're finally making enough colors to cover the full spectrum, rather before it was just like everybody's like looking chalky. Right? Like, so like now we have options. So sunblock at any age. Then we start looking at just simple skincare. Don't overdo it. You know, simple, gentle cleanser. You don't have to overdo it, because a lot of people think if you're gonna go the most strongest and like whatever, no, you're just gonna make it worse and gonna probably cause acne and scarring from it, right? A lot of people with acne have that problem. They think that the harder they're gonna scrub their face, the better it's gonna be. No, they're actually over drying their acne, that the oil glands, the body will retaliate by producing more oil. They get more acne on top of it, right? So gentle is fine. Some kind of exfoliation, like for younger population especially, you get nice little scrubby. Maybe this year I'll donate some scrubbies for our gift baggies, you know, basics like that. Then we can go like after 30. So I usually, back in the day when I trained, we used to say, you know, you should start Botox around the age of 33. Right now I get a lot of younger, whatever that new generation is, they come in 20s and they're like, freeze me, right? They want their Botox. They never want to even see the movement on their face, let alone a wrinkle. But in mid 30s, you know, early 30s to mid 30s, where I would say you're doing preventative little baby Botox, right? Or similar thing. Now, you all can probably last a little longer. I know you're more than 30, Tiffany, but
Get
you
ready
don't
for
have a
it.
wrinkle.
I mean, but sometimes I think about it because I started looking at these right here, and people call them like smile marks or something.
Yeah, well,
or,
that's not Botox. This thing right there, you just made a face with
in
that
the
stuff.
middle.
Now that is Botox right there.
So I
That
need
face. And some
freeze
people
this
make that
maybe.
face without thinking. It's like they're thinking face, like they're looking at the phone. Somebody said something, and you make certain faces. Then I'll say, okay, Botox it, because it's gonna help us not to make that face, and therefore the line will not set in place. So, and it also just kind of makes the skin, you know, brighter, lighter, whatever. Right. And then some kind of procedures once in a while, either microneedling procedure or chemical peel. It has to be light. You have to go to a specialist if you're going to do that kind of stuff. That will not mess up your skin, because chemical peel for light skin, white skin, I can fry my face. Nothing's going to happen. I'll do same thing to you. You might get hyper or hypopigmentation, which is not something you want, right? So you have to find a person who actually knows what they're doing with lasers, chemical peels, microneedling procedures, and stuff like that. So the way I look at skincare with those procedures after 30, skincare is like brushing your teeth, right? You at least twice a day, you do something. And then going to a doctor like me, that's like going to a dentist every 6 months, right? To do the cleaning. So you want to kind of do something there for preventative stuff and maintenance stuff. And then at home, you're going to do your regular things. At home, sunscreen, we talked about some kind of exfoliation, scrubby stuff. And as far as skin products, we're always talking about some kind of growth factor. Vitamin C prevents discoloration and keeps your skin bright, and also protects you from antioxidant. It's antioxidants, so from oxidative stress, from free radicals from the sun. And those are the main, and tretinoin, right? The retinol, tretinoin type of products. A lot of my skincare, because mine is more natural for sensitive skin types. So the purple box, the things that you guys seen, I add it's not Bakuchiol, it's Bakuchiol. It has to have Kuchi in it. Bakuchiol, proper pronunciation. So Bakuchiol is like a natural tretinoin. So it acts like it, but it doesn't make you sensitive to sun, so you can use it morning and evening. So I add it to my skincare to get skin ready for when person is finally ready to use actual tret, which is prescription medication for skin. So between all of those things, protection, continue to maintain brightness, taking out the dead skin layers, exfoliation. And then things like tretinoin, what it does when you put it on your skin, it makes your skin turn over faster. That's what happens when you were a baby. Your skin turn over very faster. So we have that basal layer of skin cells, and then they kind of become older and die, and we get that dead layer of skin on top. And that turnover happens over a period of so many weeks. When you were a baby, it turned over much faster. That's why babies make faces. It doesn't stay that way. Right? And like if you ever have a baby, like have a paper cut or something or cut, like they heal within like a week, and it's like, where did it go? Right? Because their skin turns over so much faster. And as we get aged, it turns over way slower. We don't build so much collagen anymore after 30. After 30, we break more collagen than we make. And so between all of those changes, all of a sudden things start to settle into the wrinkles and lines. So tretinoin helps us the turnover. Exfoliation helps us to take over the top layer of skin, the dead cells, so we don't see those set lines so much, or that crepiness of the skin, right? And then vitamin C will help us to prevent damage from the sun. And of course, sunblock is sunblock.
Mm-hmm.
Right? So there's certain things you want to hit in your skin products that prevent, protect, and stimulate collagen production. That's where some of those procedures do. So procedures like, again, microneedling, lasers, chemical peels will help you. Even diamond glows, like kind of like the hydrofacial diamond glows, when we kind of exfoliate with the little metallic thingy, it will stimulate more collagen production. Right? So a lot of those procedures, I aim to continue that elastin collagen production.
I love this.
That's good. So when we think, because I saw some other people talking about like the difference, the smile line. So when you think about that, so after we've gotten down and we've really gotten to the basics, now we have the basics down and we're like, all right, now it's time for us to, maybe we need to elevate our skincare and what our face really looks like a little bit more. What are what are some of the best tips that we need to think about for these smile lines?
Practice your resting bitch face.
Oh, I got that down pat.
I'm the worst. I'm always smiling.
Me too. Like
Literally,
I always do that. So we can't get some Botox in here. We can't just.
So the smile lines are folds, so they're not Botox. Botox relaxes the active muscle, right? So if I put Botox here, I physically see that face that you were making. I can't this is all, right?
Wow.
I cannot do anymore because it's Botox, so I cannot actually frown. I can make a face, but I cannot actually come together, right? I have a little movement on top. Normally it's way more lines, right? I'm almost 50 years old, so I don't know. So when I go up, I have a little Botox there, but I don't put full dose, so I have some movement, but it's softer. There is not a muscle here that's going to make you you're not going to smile at all. I cannot Botox your smile muscles. Then you'll be you won't be able to you'll slurp and stuff and drool.
We don't want that now.
Yeah,
so that's where fillers come in. So fillers is usually what people use. But again, fillers have to be used properly, because people who really go after the smile lines first and do too much of it, that's when they get the tomato face.
Oh.
Yeah.
If they don't address the cheeks first, right? A lot of times the smile lines, because we have little fat pockets here, that normal fat, part of your face had little fat things, and they start to slide down as we get aged. And so idea is really we need to bring them up. There is procedure called mid-face lift, middle face lift, like mid-face facelift. Sometimes we can do it with a little string to try to bring that up. In some people right now, what we're doing, I'm putting filler up here to try to minimize appearance of this line. And then I'll put a little filler is okay, but you don't want to completely make these smile lines disappear. One, they're natural. That means you're a happy person and you smile, right? But two, if you do too much, you're going to look very unnatural. And that's where they start looking bulldoggy.
Oh, no, I'm trying to look like that.
Have you seen that? They get a little ducky bulldoggy look when they put the...
A quick question, Dr. Angelina. So of course, our face is going to change throughout this journey. Is there any recommendations for anyone? Especially right here. What can someone do in reference is they're still actively, I'm trying to choose my words, losing, what can they do for like face care, just in general, because how my face look at 215 definitely does not look like that, but I neglected my skin until the last year and a half. So any advice that you can give on someone starting their journey, what can they do, what products,
Facial yoga.
Okay.
Well, number one, for those who haven't started the journey, actually, I'm starting to dislike word journey. I've been making fun of it. I don't know if you saw my post. I made a post like, anybody on a blood pressure journey? How are you doing on lisinopril? Because everybody keeps asking about it like it's a thing. I'm like
how's your
nobody
journey
does
going?
it to like diabetics or like anybody else. I'm like, how's your blood pressure journey? Let's talk about that.
Our skincare path, I like that. It's just so many.
There you go, skincare.
So many people are now getting into skincare.
So number one, start doing stuff. Same as Chelsea was talking about working out. She started before she started losing weight. Like, don't wait to start doing stuff until you feel like in the mirror or whatever that you need to do stuff. Like by that time, it's showing it's too late. Right? So number one, start doing things just forever. Like just do it. It's again, we're talking about lifestyle changes. So that's part of your lifestyle change. Do something.
Nutrition.
Anything you do is better than nothing, right? Do stuff. I know I laughed when I said facial yoga, but actually it's a thing. You can find a lot of videos out there on that. I'm not allowed to say where, but the place where people watch videos. You can type in facial yoga and you'll find a lot of like tutorials. It's funky. You do like a lot of funny faces. And it actually, if you do it, it's quite hard. It does tighten your muscles and build your muscles so they don't sag. If you start doing it early enough. Now, if you're already like down here, I mean, it's already down there. But you can definitely try to do stuff like that and just do stuff. I hate when people showing up at my office at like 58 and they're like, fix me. Like do one thing. I'm like, well, let's do Botox, let's do filler, let's do laser, let's do, surgery. I can give you a whole list because we're treating skin separately, under skin volume separately, muscle separately, right? They're all different components of your face. And they're like, no, I don't believe any of that. I'm like, oh, okay. What do you want me to do? Like, fix me with one procedure. I'm like, you neglected your face for the past 58 years and definitely last 20 when like after 30, I usually say start doing stuff more, with intention. What do you want me to do? Right? And they're like, well, you just got to fix it, right? Like, I'm like, there's 20 years worth of damage. It's like somebody who hasn't brushed their teeth for 58 years and then shows up with a dentist is like, make it great again.
Fix me right now.
There's only so much that can be done.
Yeah.
Like there's so much we can do. There's so many components that I don't believe in this. I don't believe it's like that. They do that TikTok where like, what do you want me to do? Like, what do you want me to order? I'm like Uber. Like, get out of here. Like, what am I gonna do?
Yeah.
Start now, right now.
You gotta start now. Like whatever you do is gonna be better than nothing because a lot of those people showing up at that age, they're like, well, I didn't believe in it. I was aging gracefully. I never needed anything. I was like, yeah, like same as brushing teeth, like you don't actually need to do it right away, but eventually it will catch up to you. So you're showing up like here toothless and then what do you want me to do? Right?
That's a good point. I talk about that all the time because I was never a person who really, my skin was great. And I usually just use, warm water. That was it. And that's just not enough. And so it's like, now I'm like, oh, I need to do something. Oh yeah, of course you need to take your makeup off at nighttime. I just go to sleep, Dr. Angelina. I just go to sleep sometimes. It ain't no good.
I'm kind of like that too. Up until 38, that was me. I've never done anything. Now I was a general surgeon, trauma surgeon, with 2 little babies at home. I did not do shit. Like, well, one, I did not think about it because, in plastic surgery, it's different. I only started getting into it when I switched my specialty to cosmetic surgery. Before that, like, we don't think about this. I work 30-hour shifts any given day. Like, I don't sleep like 24/7. We used to, because we're private practice, so we're always awake working 24/7 basically. And so I did not do anything other than warm water, same thing, and baby wipe for my makeup when I felt like it. I was like the worst offender. So when I started doing this stuff, I think my first time I had Botox, I was like a little baby Botox at 30, like 4. Somebody gave me a little bit, but then I realized I was pregnant, so it probably was not a good idea. And so but I got back into it when I was like 38, like really on regular basis. So now it's obviously a continuous thing. But yes, in the beginning, I feel like all this trends with teenagers going to Sephora and buying all kind of like craziness, like I think that's a waste. They don't need any of that. They just need sunblock, fine tinted moisturizer if you want to.
They're doing more than I do. And I'm just
They do
what
way
in the
more than I
world?
do. And I have all of it on the shelf. Like I got all of the skin products that I made myself. Like I have my own skincare line. I do less.
Yeah.
I just
They're
did a
getting
video.
unbelievable.
I just did a video this morning. Really quick, Dr. Angelina. Someone asked about glutathione and dark circles. But really quick to what you're saying, I did a video this morning. You can do all of the internal things. You can go to Dr. Angelina and she does all of the things. If you do not have the basic facial cleanser, toner, moisturizer, and SPF, you're defeating the purpose of going to her or doing anything to your face. You have to take care of your face. You have to have a good skincare regimen. And people don't. They just think that I'm going to go, she's going to fix me, and it's going to be like that. You can't. And drinking your water, absolutely.
Yeah, drinking your water. Yeah, you have to do that.
I ain't no good. That's all I can say. I ain't no good. I ain't no good. But I have heard a lot about glutathione.
That's all I really use is sunblock. Because I was like, that's enough.
It is enough because you're a baby.
If you, at the age of 53, Jay just got on me about using sunblock. And that's why your girl had melasma. Okay? Put on
Well,
the
melasma
sunblock.
also happens from pregnancy and hormone changes. I got my melasma from birth control pills when I was 18, 17. Because I have PCOS, I had really bad menorrhagia, meaning, for a week. And I went to GYN back in the day, and they're like, well, here's a birth control you're going to take to slow down the bleeding. And they gave me like the strongest pill available with iron in it. They used to have that birth control pill with iron. I don't know if they still have it. It was like very strong stuff. And like for 3 years I was on it. I mean, it definitely controlled my period. I was not bleeding out, but it was strong enough to develop. I had this huge spot of melasma right here that developed from that. I didn't get pregnant until I was 34. But that was from that. And I didn't know it. I was sick every morning. I had like literally, like I felt like I had morning sickness every morning. I survived on Pepsi. I drink Pepsi every morning going to college.
I love it. I love a good
And I didn't know I was sick until one day I went back to the place. I used to go Planned Parenthood. Like I was in college, I was broke. So I used Planned Parenthood as my, care, right? They do free pap smears. They give you birth control for 6 months for free. I'm like, win-win, right? And so I would go there, and then it was another doctor at that point, and she's like, well, this is a little too strong. Let's switch you to this other, like whatever low, like LO at the end, right? So low hormonal pill. And the first time I started taking it, I woke up, I was not sick. And that's when I realized I was sick for 3 years. I literally had to drink a bottle of Pepsi every morning because I was so sick every morning. I had morning sickness, but I had this big ass melasma that wouldn't go away until now that I'm doing lasers, I'm doing all the brightening, I'm doing all that stuff. Now melasma is clearing out. But if you look at my pictures, like my wedding pictures, I have pictures, a big ass melasma spot here. Hormonal. Melasma is hormonal.
Okay. Yeah, mine was, yeah.
So, and I mean, sun does not make it easier. Once you got melasma, it's not just the sun exposure, it's the heat. So you could be sitting in the shade, like when you, like down south, right here, get out, sit in the car after it's been outside the whole day, and you come into that, basically sauna. That heat inside the car will activate your melasma, even if you're in the shade.
Okay.
So it's not just direct sun exposure. You can wear your hat and you can, but even you covered, you still, if you're in the heat, it can activate melasma.
That's good right there. Wow. So what are your thoughts on the glutathione? What do you think about that?
So it's not FDA approved for skin brightening. I know a lot of people believe that they can, inject it. I had people coming in asking for glutathione IV injections. Like you have to do so many treatments. Like it's not one and done. Right now with peptides, there's not true evidence that's going to truly brighten you. I think in Africa, because I had this African lady coming in and she was like, they wanted to use it to like do it continuously, like I don't know, Michael Jackson treatment or something. Like they were trying to like brighten herself. Like she wanted to change her color everywhere. Like she wanted to be lighter. And I'm like, dude, like that's one, it's waste of money. Two, if you overuse glutathione, you're probably going to damage your kidney, right? So it is antioxidant. We do know that. It helps to recycle your vitamin C and vitamin E, which we know vitamin C helps you with brightening as well. If you use Tylenol, I pulled that up too. Glutathione with Tylenol together can definitely cause toxicity, so you have to be careful with that.
Oh, wow.
And the results are not confirmed, meaning it varies from person to person. So if somebody comes in and say, how much glutathione should I take to brighten out this whatever skin color? Because it's not going to just go for under eye circle. It's going to work your whole body theoretically, right? Well, how much do I need? I have no freaking idea.
Dr.
I do not know how much you need because there's no clinical trial that tells me how much you need. Try it and find out. So I was like, yeah, I have glutathione in my office. You want it? Here we go. Don't overdo it and see what happens. That's most of the peptides though. Same thing with BPC 157, GHKCU, NAD+. None of them are officially proven to do anything like clinically. And I cannot give you any numbers. Right, on semaglutide, I can tell you after 18 months of use, average of 17% weight loss. On tirzepatide, average 23% weight loss. Like those are the side effects. Those were the clinical, whatever issues. I cannot give you that data on glutathione or BPC 157. So you can try it. We use it sometimes in the facials when we do little microneedling procedures. We'll add some glutathione into those facials, like PRP and stuff like that. And we'll add some glutathione to it. We can kind of microneedle it in. So I guess for dark under eye circles, you can try to do that plus PRP underneath here to inject.
Right? Do you do that, Dr. Angelina? Do you do that for the eyes so I can make my appointment? I will make my appointment.
We do everything.
Ma'am, okay, I'm sitting up here walking around and these people hazing me about my raccoon eyes. I will see Dr. Angelina.
You need some filler. You need some filler in your cheek too.
Oh, don't get me started. Let me go talk to him. Let me tell him.
I'm done.
Work.
So, Dr. Angelina, and I've seen a few people talk about like the neck, and so I know I have some things going on with my neck a little bit. Nothing that really I don't know what you're gonna say about it, but what can people do? Because we know again, we're minus losing all over, and then you have the neck, and then some people have it a little bit. I guess somebody call it turkey neck, kind of in the thing in the chat. So
gobble gobble.
Gobble.
Yeah, gobble gobble. So they're wondering too. This must be a huge thing of what can anything really? Because we know.
Yeah, let me show you some pictures. This was we talked about it earlier. Botox. Somebody with dark skin who's not really wrinkly.
Oh yeah.
Ooh.
Botox before after. She actually did have a couple syringes of filler. So again, she looks like her other than she changed her hair in the 2 weeks, but she did have 2 syringes of filler here and she had some Botox, but see how it just refreshed her? Proper Botox filler should do that. Okay. So again, you can see how like a little crepiness, like a little bit like of lines on the forehead.
Mm-hmm.
That's what Botox does. Okay. Now let's talk about neck. Hold on, let me pull up some procedures that does neck. So neck, we have skin tightening procedures.
Ooh,
I don't know if I'm going to get blocked again. So this lady was still in the process of losing weight. You can see on this picture, see how like it kind of hangs?
Mm-hmm.
And see on this one, it's less. This is about 4 months apart. So this tightening procedure, I go in, it almost looks like I'm doing liposuction, but I'm not necessarily sucking fat if you don't have any fat, but I'm delivering heat. So it's like cooking bacon on inside. So it's a little procedure, but it's like through a little tiny hole, like liposuction. I'm going in and I'm delivering a lot of heat in there. And on the inside, it starts to shrink. We have a couple of different variations of that procedure. But it helps us to shrink the gobble gobble. Is another one.
With the gobble gobble now, I mean, how many, like, does it tell you like how many, like, or, because they're trying to get it fast. Okay. They like, can we be one and done? Or is this did you put them on a whole 6-week, whatever regimen? You need to come back 6 times.
No, this procedure, like this more invasive procedure where I go underneath the skin, it's one procedure. It takes up to 4 to 6 months to really see the full result. Like most people will see result even like in a week once swelling starts to come down. but up to 12 months, it can actually continue to shrink, right?
Wow.
And most people will say probably lasts about 5 years. Whereas if we're doing facelift, a lot of people will say 10 to 15 years after surgical facelift, right? So it's still pretty good for non-invasive, minimal downtime kind of thing.
Wow.
It can be much more impressive. Like this lady also had that same procedure, but combined with liposuction.
Oh,
That's
wow.
her 4 days later,
Goddamn.
right? It's more impressive looking because she had more hanging, right?
Oh,
That was
yeah.
before she lost any weight. She was like 350 pounds in the picture, but she was bothered. It was like during Corona time. She was bothered by this, and she's like, I'm Zooming every day. I'm on Zoom. I can see my own face. Do something. I'm like, all right, let's do something.
Wow.
Now, this lady lost weight, and she was getting more gobbly gobble. So from here to there, so you can see it's not 100% gone, but it's better.
It's
much
much
better.
better. Just a
Right.
profile.
Better.
So we have to have proper expectations for procedures. Like if it's a non-surgical procedure, we cannot expect a facelift result,
Mhm.
right?
You have
If
to
I'm
make the
telling
right
you.
expectations. That's right. Now, someone did ask about a cream, and I know, sometimes
what?
you just gotta go to the carving table. But is there a cream that can? I mean, look, Chelsea said. I mean, look. we
Thank
see
you.
all
Her
the
face
people-
made my day because it's hilarious. Like,
For
I
what?
mean-
Your BBL?
No,
No.
they're talking about the
Oh.
They're talking about the gobble gobble. They're talking about the turkey day. So yeah,
I know they try to sell you a lot of crap here on this platform for the creams that's supposed to make your, like arms tighten. I've seen those. Like, look, I got this cream now. I'm going to tighten my arm. You may be able to improve skin quality. So some of that, kind of like we start getting that dryness on the neck, right? We start to get the skin changes. Skin changes you might be able to improve with creams. Again, hopefully you start doing the creams before you got to that point, right? To continue improve. But I think the actual laxity, the amount of skin, I mean, if we truly had those creams, I'll be first one selling them.
yeah.
Mhm.
If they truly had them, I'll be putting, like, I might rather give you a cream than operate on you.
Right. What is the pain level for that? Because I'm all about pain. I have not birthed a child, and so I'm not like Chelsea was like, well, it's like a C-section. I'm like, what if you've never had a C-section? Like, what about those types of things? Like when you have people that are like, I have a low pain tolerance, and even though if I want to have something like this done, what does that look like?
It's numbing. So if you can tolerate numbing medicine, if you're super anxious person, like I have some people who come in like they visibly have anxiety, where you're like, shot for her, shot for me. But they, we can give medication to calm somebody down just so they don't have to worry about it. We have Pronox, which is that laughing gas that you breathe yourself if we have to. If somebody's truly very much, it's not necessarily pain that you cannot tolerate. It's here. It's
Yeah.
what you pretended or imagine it's going to be.
Yeah.
It's usually not that bad. And the worst part of any of these procedures when we do awake is numbing medicine. If you ever been to a dentist, if you ever got a shot of numbing medicine, the first injection, it kind of burns when it goes, but once it's done burning, you're numb, you don't feel anything. So I have a lot of people who even think they're anxious, they tolerate these procedures very well because we walk you through it, like a little pinch and a burn, a little pinch and a burn, and then by the time it's done burning, you're numb. And then it just noises, which will walk you through. Like now you're going to hear this noise and now it's going to vibrate a little bit. Now it's going to be sucky noise, like liposuction, so then you just kind of like hang out there. And we talk to you. You tell us all your deep, dark secrets.
We family now, so yes.
They do.
So-
I had people telling me about their mothers and grandmas and family history because they just want to talk and they just we start like, okay, tell us about this. And they just, it's a therapy session.
You're calm. Now I saw somebody else too, and y'all please feel free to add your questions into the chat as well. We'll definitely take some questions for probably the next 15 minutes or so because I got to go get my nails done because they look
Yeah,
horrible.
I actually
But-
think I'm gonna have to hop off here if anyone.
Okay.
Thank you, Chelsea.
Thank you.
Thank you, Chelsea, for being here.
Please
Yeah.
make sure y'all are following Chelsea. Please, we are enjoying her journey. Please go back and look at, again, you're only seeing we at 95% right now. So you got to go back and you got to look at everything because her journey is phenomenal. It
The
is
last thing I
phenomenal.
wanted to say was if you guys are thinking about starting your journey, just start, because at the end of the day, we want to compare. We want to say, oh, I can't afford it. I can't do this. But the only person holding you back is you. So you got to go after what you got to go after. And we have to take back the part of it being so physical. We got to think about our health because yes, I wanted to lose. Yes, I want to look good, but I did this for my health. You know, your kids want to see you here. You want them to see you grow. You know what I mean? You want to see them grow and everything like that. And that's what it comes down to. You got to realize that this is more than just, for your outside appearance. And that's what's truly going to get you through the next level because you're like, wait, I'm doing this for a purpose. I had so many health issues before I started my journey. And now all I see is green when I go to the doctor, which is so crazy because never in my life have I ever seen green. It's always red and telling me to get on this and this and this. So if you think you can't, you truly can. I promise y'all. But thank you guys for having me so much. I appreciate you guys.
Thank you,
for
Chelsea.
being here.
This has been phenomenal. Thank you so much. Again, make sure that y'all are following Chelsea. She's great. She is wonderful. Thank you so much. Enjoy the rest of your day too. Thank you.
And hopefully I'll see y'all in ATL because I'm about to go
Yes.
book my
Pull up, please. Pull
All
up.
right, y'all.
Pull
Bye,
up.
y'all.
Thank you.
Thank you.
Thank
All right, you
you.
guys. I probably have to go to. Do you want to do a couple more questions and then we go?
Yes. So I saw someone that asked about red light therapy, and I see that a lot, like those little masking things. Like, what are your thoughts on
There's
that?
a little mask, and they sell them in a doctor's office for like the whole body, kind of like the old tanning machines. Now they make them like in a red light therapy thing.
Mhm.
It's any of those things that are non-invasive like that you do at home. Same as like I had the little wand for the whatever skin stuff, right? It works if you do it regularly. So if you're going to do the red light hat for the hair growth, you're going to do it at least twice a day, every day for 10 minutes, right? If you're going to do it for your face, for your belly, for whatever, you have to do it regularly. But some people do it like once for 10 minutes when they first bought it and then never touch it again for like another 4 weeks. Like, it didn't work.
That's right.
It's like exercising. Like if you don't do it every day, it's not going to work. So
You are quick to say things about something not working and they're not consistent with it, for sure.
Right.
For sure.
Same thing with GLP-1. I see the same thing with GLP-1s. It didn't work for me. I was like, well, how long do you take it? Like, oh, like a few weeks. But then I skipped 3 weeks and I took another 2 weeks and then it still didn't work. I'm like, okay.
Mhm.
Yeah.
I know that's right. I saw somebody say they have an appointment with you next week.
Yeah.
Let me see. Hold on. I'm going back up. Any additional questions? I think I went through majority of them.
Are we getting all the same questions on the bottom here? Is it all combined?
A lot of them were. People were talking about the turkey. So
Okay,
yeah.
okay, so that is okay.
Mhm.
I didn't know if we see like separate chats or we like
Yes, we can see everything down here.
Mhm.
Any additional questions for Dr. Angelina? Please go ahead while we have a quick moment as well in between questions. Please make sure that you are following Dr. Angelina. We may see her in ATL this year, depending on her schedule. I mean, Dr. Angelina is a wealth of knowledge as well. So please make sure if this was your first time ever seeing her, I already told you, you made it to the right side of TikTok today because she is phenomenal. Phenomenal. So we appreciate you. I don't see anything else coming in at the moment. I'll give them another moment, but
I like Leah said, she's under that lizard lamp every night.
Look, I mean, hey. So someone mentioned about hollow eyes for fillers. So
yeah, you can do some fillers, but again, you have to sometimes put some cheek up, depends on your age. Sometimes you have to do a little cheek and under eye together. What lab do I need for HRT consult? So in HRT consult, we discuss, HRT guys, make sure you mention that to yourselves somewhere, make a note, hormone replacement therapy. You'll do for that. After 40, hormone replacement therapy.
So I had a conversation with my doctor about a cream, and then we go with a cream now again. And so I haven't really gone back to really talk about that yet. I mean, what are your thoughts on that? Or do we need to
do it? If your doctor is willing to do it, it's very hard to find doctors who are willing to do it. Who does complete HRT, meaning estrogen, progesterone, testosterone. A lot of doctors don't give it to females. No particular reason other than just not educated enough on the subject. Statistically, African American women go through menopause earlier, have more significant symptoms like the hot flashes and all of those type of symptoms, and less likely to get HRT. So you have to advocate for yourselves more,
Most definitely.
as usual.
Yep, that's right. Someone mentioned about like scarring, especially like for those tummy tucks and different things like that. I know I've seen a lot of people that have gotten their arms done recently. Any recommendations for how to minimize those types of scars?
It's hard to predict on the skin quality. So I can close the same wound the same way on like 10 different people, and there'll be 10 different type of scars, right? So we have to look at your predisposition for keloiding, your hypertrophic scar. We have to look at your predisposition for darkening of the scar. Obviously, do all the protective things, scar creams. If we feel like it's going the wrong direction, start doing early microneedling and lasers on the scar, like at 6 weeks after surgery. Before even it gets to, you don't want to wait for it to get like anything else to get too bad. You want to start doing protective things on that scar early enough. If you're more likely to keloid, we want to start injecting steroids or some kind of things that we usually inject into those hypertrophic scars early. We can microneedle them with those medications as well. So there are things you can do to improve it. So just have to be vigilant about it.
What about hooded eyes? Oh my gosh, so many people are coming in now.
The questions are rolling. They're rolling in.
The hooded eyes, we can do surgery for hooded eyes. We can cut off the extra. That's pretty straightforward procedure in the office. If you feel like it's hooting to the point where you are tired of it, you cannot put your eyeliner on, you get bothered by it. So here's an example.
Yeah.
Oh, yeah.
I'm going to save this money so I can just get this face preserved.
I'm just trying to think about it. Look, I'm going back to the pain part. I'm like, is the Botox painful? Like, I understand. I know
It's
they're gonna take the needle is
painful.
small. We get some numbing things.
You haven't seen me
going.
do it to myself. I do it on TikTok all the time.
I've seen it, and I'm still. I just feel like you're just you one of a kind. You're one of a kind.
I've seen Dr. Angelina. She does it. At her first meetup, she was doing Botox. Yeah,
I know, and I was just over there. I was trying to cover one. I had both my eyes kind of covered, trying to look at.
And I reopened my office in Brookhaven now, so just FYI.
I need to come watch Dr. Angelina do all these things. I'm fascinated.
I mean, it's amazing. It's amazing. Let me see. I think I saw something else. I just wanted to look. So Jalissa talked about like the body lift. So I assume that's really like the part that you were talking about. We're pulling up and then we pull down. I'm just
body lift is typically a circumferential tummy tuck. So it's like a tummy tuck in the front, and then do kind of the thing on the back where they pull your butt up. It's more of butt up rather than skin from the back down.
Okay.
Problem. I don't do that. I don't usually do that procedure. I definitely do not combine it with tummy tuck. For most people, it's not cute when they do that. If you look at before and afters that some people who do a lot of them post, they make everybody look like they have negative ass. There is no ass.
Oh, we don't want that then.
No ass at all.
No, we don't want that. No.
Because
We need a little
what
bump
happens
in
when
the
people
front.
lose weight, yes, it might sag, but when you put your yoga pants on or underwear, and you can wear those kind of like, granny panties, whatever, the compression ones, they'll make your booty look like booty because you have skin in there. But if they cut it all off, that'll be nothing. So if you look in the mirror, like if you have a little bit more loose stuff, and you go there and so they take this stuff that hangs and they pull it up and cut it off. And so this part right here now becomes like in there. I cannot give myself a wedgie like that, but you know what I mean.
They gonna look like they got iron boarditis.
No, we don't want that.
They not gonna and that looks pretty bad.
Yeah.
I had one patient like that. She was actually looking for thigh lift elsewhere. She was up north, somewhere, New York, New Jersey. And she went to a doctor who probably didn't do thigh lift. So he's like, we'll do a body lift and it's going to get better. How does lifting your ass helps your thigh? I still cannot figure that one out. It doesn't. So what he did, because she was like hippie, she had like a big booty with like a ledge in the back. She had big hips and big thighs, right? So he gives her tummy tuck, the circumferential one, cuts off half of her booty. Now she has this wide hips. And if you look at her from the side, she's like like this.
Mm.
So now she's like, I cannot wear anything because now I look like just like somebody squished me like that, right? Like, because the hips are still there and there's no booty. So it looks completely odd. So she was like really depressed, gained some weight back. So then I had to do the thing where I had to do like thigh lift. I did liposuction and I put more fat back in her booty to try to like fix that.
Yeah.
But
Unbelievable.
you have to be careful with those circumferential body lifts.
Mhm.
Now
You
I had a
understand what
question
you
for
mean.
myself, and I've seen some people who go back and forth with drains and no drains, and so I've mentioned again about how am I going
Whatever
to
your
decide to do
doctor
this?
decides.
Okay, so there's no rhyme or reason really.
There is reason why surgeon wants to put a drain. Let your doctor decide. Drain is not the problem.
Okay.
People worry about the drains like, really?
It's all in the head. That's what you said. That's what it is.
It's not an issue. By the time drain starts bothering, usually it comes out. I mean, you can ask your doctor how long do you keep the drains. My thing longest drain was usually 10 days. Usually take first drain day 5, second drain maybe day 10, maximum maybe extreme situations 14, but that's it. I never keep drains longer than that.
Okay.
There are some doctors who may keep their drains longer. So you can find out with that doctor, but the whole drainless tummy tuck, pay extra to have drainless tummy tuck. You can still get seroma, which is why we put drains to prevent fluid collections. You can still get fluid collections even if you had drainless tummy tuck. It does not protect you 100%. So from my standpoint, especially population of patients that I get after weight loss, that does not make sense to do. But some doctors don't mind doing that. So you have to, again, whatever doctor has comfortable doing. Don't choose your doctor based on a drain. Like that's not,
Okay.
plus I can promise you no drain, but if I get in there and things look certain kind of way, I'm like, guess what? You're getting a drain. Same thing when we do any abdominal surgery, when we go to nobody ever discusses it when they have a gallbladder done, when they have intestinal surgery, appendix surgery. We don't discuss drains when you go into surgery. We're like, we're taking you in, we're going to fix you. Right?
Mhm.
I'm going to do what I'm going to do. I'm going to do what I feel like is safest to prevent you from getting sick afterwards. So if I feel like I need to put a drain to prevent an abscess formation, a pus pocket formation, poop coming out of the wrong hole, like whatever the reason for the drain, I'm going to put as many drains as I need to.
Yeah.
Right? So
we need to hear. We
not
need
tell me
to
what
be
to do.
honest.
Yeah.
It's not our feelings because we don't know, because we are not the expert. So
Right. But that's how, the way for me, especially coming from the general trauma kind of world where we used to line up drains, people come out like 5, 6 drains because look, if you're coming in and your belly's full of shit, literally, with perforated bowel, you're going to have a lot of drains. We never ask the patient, do you want a drain? No. You just like it to be alive. Be happy.
amen.
Right? So plastic surgery, I know it's elective. We're going to try, but if you got to do it, you got to do it.
That's right. Well, Dr. Angelina, this has been phenomenal. I feel like we need to have you on again one day for sure, because
Let's do it.
there's so many things that we know if we've gotten to this part, or we're trying, like you said, a lot of times we need to just start now, no matter where you are in your process, no matter where you are in your transformation, whatever words you want to use in
The journey.
right? So this is just something that really has to, you just got to just do it and look into it and find the right people too. Y'all know we talk about this multiple times, that there are 1,000,001 people on this platform, okay, on TikTok, and you've got to make sure that you are following some of the ones that actually know their stuff. But then also you have heard the ones that know their stuff, making sure that you go talk to your doctor too, because your doctor is the one that knows you. Do not be afraid to talk to them. They are talk to them just like you talk to your best friends, okay? They're your new best.
You have to, because they cannot read your mind no matter what you think. We do not know. I can sometimes feel emotions. I'm like, what's up? I cannot read you, but I can feel somebody's holding something back or not saying stuff. I'm like, just say it.
Mhm.
That's it.
Well,
we appreciate you.
I don't care how weird the question is. We've heard it all. Trust me.
That's right. Look, y'all heard what she said in the beginning. Just
I
drop
have
it.
heard that question before, or I have seen the
They didn't
situation
see
where
your
that was
whole body.
applicable.
So there ain't nothing to hold back on now. There's nothing to hold back on. So I'm excited to definitely have you back again sometime soon, Dr. Angelina, because this has been great. Any last words from you, Kim?
No, I'm Um, Thank you for coming on, Dr. Angelina. Thank you for sharing your wealth of knowledge. And like Tiffany said, we would love to have you on because we're still getting questions and you're discussing things that need to be discussed in this, not even this in community, just in general. So thank you so much for your expertise, no medical advice given, and her experience as a physician.
Right. And her honesty, because honesty is the way, I mean, that's what we need. That's why we have real people on that just gonna give it to you straight. That's it. So we appreciate you, Dr. Angelina. This has been a phenomenal live. I have so many notes and I'm like so many things running through my head. I'm like, okay, I think I could do this. I could. Now I actually think I can. So yes. Kim, are you staying on?
Yes.
Okay. All right. Well, Dr. Angelina, we appreciate you. I am running as well. I'm gonna run to the nail shop because I don't even want to show y'all my nails barely. Okay. But thank y'all again. Make sure that you are following Dr. Angelina. She the GOAT. She is the GOAT. Thank y'all. Have a good one.
Thank you. You guys have a good Sunday.
Bye, y'all.
Bye-bye. All right. Happy Sunday. It's 12 o'clock. I'm going to stay on with you guys from 1 o'clock till 1 o'clock. The reason why I just want to thank Dr. Angelina, Chelsea. Thank you so much for coming on. I owe you guys a live. So let's get into it. It's a lot of stuff I want to discuss. No medical advice given. This is just my experience, unless you have a question about a prior authorization or diagnosis code. This is just my... Thank you so much. Thank you so much. I wanted to have a live where we're going to discuss, you don't even have to get to your journey, but skincare, what you're going to do once you get to maintenance. That's a lot of questions that I get a lot. I said I was going to do a live and address that. I want to do a live and address my journey because so many people... I'm just going to dive right into it. So a lot of people have a problem or an issue with what I do on my maintenance journey. So I'm going to tell you what I do for my maintenance journey. It's for me. I show you guys that there's life outside of stepping on that scale. Do I do other stuff? Absolutely. But however, somebody got triggered with me going to brunch with my husband. I don't know. That is me. If I want chicken and waffles, I'm going to eat chicken and waffles. My husband is not on a restrictive journey. My family is not on a restrictive journey. So I am not going to be restrictive simply because some people feel like I should not eat the way that I should eat. Some people feel like I should not do the things that I do. Sorry, I am not the creator for you. I am going to be who I am unapologetically. That is just it. Yes, sis, you know I'm serious. So me and my husband have this thing where we have a date night and we have date brunches and we're already planning our next brunch. I will say this and people are going to, I don't care if you get offended. I'm the one in maintenance. I'm the one that's been maintaining my goal range. So that's it. That's all I'm going to say. It's working for me. Okay, I got on the scale this morning. I'm 148. I had my labs done. My A1C is a 5.2. So it's working for me. Okay, what I'm doing is working for me. All right, so happy Sunday. Welcome in. I hope everyone is having a good day. Star the distractions, feed the folk. That's what I'm going to do because, hey, that's what it is. Welcome in. Happy Sunday. We're going into a new week. I think it's March 1st today. Happy new month, new goals. I'm not even going to say new goals. New month. I want to eat in portion control and change. Yes. And that's the whole thing. That's what my page is about. My page is about showing not being restrictive. My page and my journey is showing that you can achieve results. New formulary changes, guys. Yeah, thank you, Kat. New quarter, new formulary. So check your formularies. A lot of people who don't think they may not have coverage, check your formularies now. Between March and April, check your formularies to see if you have coverage. You may not get one. You may have an. So yes. Hey, Nurse K. Yes, I'm in maintenance, and I am not. I was going to do a video. I am not going. Some people are rude. Some people are cruel. Some people are abrasive. A lot of y'all are abusive when you come in someone's inbox simply because they don't give you the information that you feel like you're entitled to. If I see that you are rude and abrasive, I'm just gonna block you. I'm just not gonna answer you. I'm in that phase of my life. Now, however, I will come out and give you a good read, okay? I'm just not there. I'm in my peaceful era. I'm in my maintenance, enjoying era. I'm in my it's summer, I'm outside era. I'm in my skin is flawless era. So I don't have time. Now, do we all share our journeys? Absolutely. Do we all give you what works for us? Yes. I'm truthful about everything that I do. You still have to eat. They don't think that. They think eating is restrictive. And I'm not going to restrict. Like yesterday, when we got back from Charlotte, we went to Outback. I had salmon with some Creole sauce with shrimp, a sweet potato, baked potato, and some broccoli. That's me. That's my lifestyle. I tell you, I eat out a lot. We eat out a lot. So that is my lifestyle. But the choices of food that I make. So let's just debunk this. So we see a lot of people now coming up with GLP-1 friendly. It's not lucky. It's not lucky. How is it lucky? Oh, dead. Oh, boy, I was about to read you, BJ. Hey, baby. I was about to say, Lucky. Ooh, son. Hey, baby. I need you to be like, hey, mom, because I'm about to read you. Hey, baby. I was about to read my son. I'm sorry, son. When you get to your duty station, you can eat what you want to eat. I'm sorry. Hey, baby. Oh. Hey, baby. Hey, BJ. Hey, baby. Have an Outback. When you get to your duty station, baby, you listen. When you get to your duty station, baby, you can have you some Outback. We'll take you to Outback, okay? we will take you to Outback. Hey, baby, how you doing? I texted you yesterday. Yo, I texted you yesterday. I was about to say, Lucky Hoodie, no. BJ, baby. Y'all, there go BJ. I love you too, baby. I love you more. I love you. Had to look at the picture. Anyway, so y'all, that took me out. Look. Okay, well, go to formation. He's texting me too. Go to formation and I'll talk to you when you get done. Go to child formation, and when you get back from, I love you too. When you come back from child formation, then text me. So yeah, he threw me off. So let's get into it. Welcome in. Happy Sunday. I'm gonna be on. Thank you for the 2K. We gonna beat 300K. So welcome in. If you have any questions, please feel free to ask. You can ask about prior authorizations. You can ask about compound. I take brand name. I take compound. I also stack my therapy. You can ask about that. Anything you want to know, please ask me. I am an open book. I will tell you what I do, what I don't do, what I've tried, what I haven't tried. So yes, that is just me and my platform. I haven't been live last week, so I said, let me go ahead and stay on for a little bit. Then I got some video to do. I think I'm going to go to Whole Foods and see. I heard they got some good meal things, so I'm going to go there today. If not, I'm going to DoorDash it, but I'm going to see what they have so I can take my lunch to work. I can't meal prep every day and eat the same thing every day, because the way that my food aversion and my hyperfixation on certain foods, I cannot meal prep and eat the same thing every day. I'm sorry. That is just for me. And what I was discussing, a lot of people now are offering what you call GLP-1 friendly meals. Okay, don't let them scam you. All it is low carbs and high protein. That's it. All it is more protein and low carbs. That is it. It is not anything special. They don't razzle dazzle with a little bit of GLP-1 in there. Okay, that is just it. When you are doing protein, and I'm just going to be honest, make sure that you are getting enough protein. We don't discuss this enough. Too much protein affects your kidneys. Too much protein can affect your hair growth. Too much protein actually can cause your hair to break off. That's just like if you're using a treatment for your hair, like a keratin treatment, and it puts protein or keratin in there. Your hair will pop off. You need to make sure that you are getting the right amount of protein. You need to make sure that you are getting the right amount of fiber daily. For me, only for me, and I'm going to say this again, my hyperfixation right now, sweet potato. My hyperfixation right now is ghost pepper wings with some honey. That is my hyperfixation meal. Ghost pepper wings with some honey, sis. That's it. I've been craving that, like, and then a couple months ago it was crab boils. I had crab legs and shrimp. Good thing they did not check my cholesterol this time. Okay, they only checked my A1C. So I do have hyperfixation meals. I cook normal. For me, when I do eat out, I do try to, mine is Jersey Mike's salads. What is you guys' let's get into that. What is your hyperfixation meal? Because a lot of times people ask me, what do you meal prep? I don't meal prep. Mine is the hot mini. Ooh, that sounds so good. Ooh, baby. I haven't had taco salad right now. Exactly. Went to Chipotle. They have a bowl. It says GLP-1. It's the same crap as the chicken bowl. Like, it's the same thing. Just a little, maybe like 3 or 4 extra pieces of chicken. Chicken wings and fries and pepper. Wow. Chicken cups. Chipotle chicken cups. Okay, I haven't had Chipotle in a while because every time I eat them, I got to get their fajita thing and my breath be like kicking like kung fu. So yes, and that's another thing. So you're hyperfixated. These medications, so I'm GLP-1 label is for marketing. Exactly. A lot of people say, let me go show you a GLP-1 friendly meal. All your meals are GLP-1 friendlies. What you eat is GLP-1 friendly, truth be told. This journey is no different than when you weren't on the GLP-1. Chicken, garlic, herb, rice, and green beans. Ooh, Dominique, you just come through with the whole, I don't know. I mean, I'm a geek, and I really haven't been craving rice. Now, I'll eat rice and gravy, red rice. Y'all know we in Charleston, we eat rice like 50 different ways. So I just really been craving hot pepper ghost pepper wings with honey. And I think I may get that today. But yesterday I had that chicken and waffles with the banana caramel, and I enjoyed it. It was the sweet and savory. I enjoyed it. I did not, and I ate, and I'm not gonna lie, I ate majority of my plate. For me being on a GLP-1, if I don't eat in the mornings, my body will make up for the nutrition as if I wasn't. So yes, it works for me. They look good too, as you should. I'm not going to apologize for what I do. I'm going to have to try the wafflery. And the only thing I will say, they need a bigger space. They need bigger parking, but their food, their biscuits, 2 people can eat from their biscuits. I love the wafflery. So yeah, hands down. A lot of people have been asking about my stack. So I'm going to tell you my stack that I take that help me maintain, of course, my GLP-1. For those that are new, I do take brand name and I do take compound. I take both. I've been taking compound since 2023. I love my compound from LifeRx because it has L-carnitine in it. However, this Sunday, today, when I get off this live, I am going to do brand name 10 milligrams, and I'm going to do my injection of L-carnitine, which is separate. For me, that L-carnitine helps with that energy and burning that fat, especially as much as I can in my midsection. I am going to do my vitamin C today. I do my vitamin C now 3 times a week. My vitamin C has helped me a lot. The question of the day that I get is my glutathione. My gluta. I take my glutathione 5 nights and rest 2 nights. That is the protocol for me. I take it sub-Q. Do y'all know the amount of people that have asked me, how do you take it? How do you take it? And literally, do you like L-carnitine better than Lipo C? I'm not going to lie, Leah, I take both of them. So I can't say I like L-carnitine better. I just feel like it gives me a little bit more energy, especially on the weekends. On the weekends, I don't take my V8. I save my V8 for work. And what is my V8? That is my 5-amino acid, my C-Max, Link, MOTS-C, and NAD. So I save that because I need that when I go to work. But I will say my L-carnitine, yes. My Lipo-C, honestly, I take it because I have it. But Lipo-C does help maintain whatever. Lipo-Rex has, yes, their TERS has L-carnitine in it. So to answer your question, I'm gonna be honest, I can't say. If I had a choice, being that I've been on Lipo-C better, I would have to go with Lipo-C because L-carnitine, this L-carnitine that I'm doing is not going to be mixed with my GLP-1. It's going to be plain L-carnitine that I will be taking today. So yes, yeah, this is why I like having hosts. Tap the screen, tap the screen. Please feel free to ask any questions. If you have any questions, I saw somebody post, I'm trying Lipo-C and MOTS-C right now. I love MOTS-C. I take my V8 Monday through Friday. I'm gonna need it. That C-Max and Selink and NAD, all of those help with stressors. So I used to get very bad. I used to get anxious before going to work. And Mondays are my busiest days at work. And when I mean you got my chart messages, you got people coming in and you dealing with different personalities at work, I am a person, I feed off of energy, and I can't do that. So my V8 I take Monday through Fridays. Love it. Oh, congratulations. We're about them pens. So I put my V8 in my pens. I got them all my cartridges. So yes, I dial up my pens and I go about my business. A lot of y'all need to get into these pens. If you are taking additional stacks and you don't like needles, I'm telling you, get the pens. I've given y'all a site, MOTS-C, listen, my V8. I love my pens. And I showed y'all before, you put your little needle right there. See how that go in? And that's it. Them pens, right, they slap. Love them. I got to do that today. I got to load my cartridge today. I think I got a little bit on my V8. So yes, I'm doing another group buy for pens. Okay, so Kat's doing another group buy for pens this week. So if you are interested, reach out to Kat. I need to get me some more. And these are the cartridges. And these are my cartridge holder and my pen stands. I hate taking brand because it feels so dull. I don't know. Brand for me, it depends on the dosage. So, and it depends on where I do my injection. If I do my left arm on my injection, I'm going to feel it. If I do my right thigh, I'm going to feel it. My abdomen, not so much, no matter where. But I'm not going to lie to you. If I do my left arm, I'm going to get that. I'm going to get suppression. And I know for a fact that my left arm and that right thigh, that scale is going to move. So yes, I already know. If I know that I am, and along with controlling my diabetes, if I know that that food noise is strong, I'm going to do that left arm. And it's going to give me what I need to give. So yes. And I'm for me, no advice given, no medical advice given, for me. So yeah. And I mean, it's different. A lot of people like the quick pens. Gail has the quick pens. The quick pens are available now. I think it's a good idea for the quick pens. I don't know. I just have a feeling they're doing that. To see how it is and maybe offer the quick pens, period. But like I told Kat, the pens for Zepbound and Mounjaro, those type of pens are not only for those medications. You have it for Trulicity and you have it for an arthritis medication called Taltz. So yeah, do the quick. The quick pens from Lilly don't have back water in it. It's just the dial-up pens. So yeah, the quick pens are from Lilly Direct. If that answers your questions. Thank you, thank you, thank you, thank you. Welcome in, welcome in. It's Sunday. Do y'all have some questions? Because if I ain't get no questions, I'm going to hop off. Be honest with y'all. That's why I don't like going live by myself, y'all. I don't even gonna lie. Cat be like, I do a good job. So what else we talked about? Glutathione, glutathione, glutathione. Let me tell y'all something. Y'all are wearing me out about this glutathione. Okay, so for me, that's what I was saying. I can't wait for that glutathione toner to get here. So for your skin, the glutathione toner. Hey sis, have you tried Lipo-C? Yes, I've been on Lipo-C since 2023. Zola. 2023. For the glutathione, I'm not going to lie to you. The three best skincare I would recommend is the glutathione toner, the vitamin C pads from Medicube, and also Asterain. She has a skin serum with glutathione, vitamin C, and niacinamide. I've been using that and I've been seeing a difference in my skin. So yes, I've been on the quick pins since last year. I know that even that you showed it to me. Do you take GHKCU? Absolutely. I use GHKCU topically and I also inject. I love GHKCU. I showed the progress of my hair. I just saw somebody talk about hair loss and I showed a 3-month progress. So I can attest for me, it does help grow your hair and thicken your hair. That's the video I when I took down my sew-in. So my hair went from here to here in 3 months. Everything I do, I got to show y'all because some people, thank you, Leah, because some people be think I'm lying. That's the thing. I got a toner, gluten injections, but I'm going to get the other two. I'm not going to lie to you. If you are consistent, that Lipo-C again since Ashley Dumb. So sis, I get mine. Dr. Marshall writes, which is in Bold Telehealth, writes my prescription and they get it from the same pharmacy that Ashley had got her Lipo BNC. Thank you so much, sis. What toners? I can't show it to you because TikTok will think that I'm doing a TikTok shop, but Medicube has a glutathione toner. It's yellow. It looks separated. You have to shake it to activate it. And I use that in my skincare regimen twice a day, but I'm consistent. I use those vitamin C toner twice a day. It's in my showcase. Dr. Marshall was in the community. He's still in the community. He's just not as loud, but I can send you his link. When you order Lipo-C through him, it's $149. It's a 12-week vial. You send it to the pharmacy. And I promise you, when he sends it in, it takes like 24 hours for you to get your Lipo-C. Yes, the toner is in my showcase, sis. It's so good. It brings out. But I will be honest with you, like I said in my video, if you're taking glutathione internally, please send information for glutathione or for Lipo-C. That's just where I get mine from. If I message you, can you send me the link for the Lipo-C? I can send you to the doctor who writes the script for Lipo-C. Absolutely. I've been using Lipo-C since 2023. Lipo-B and Lipo-C, but I cut out Lipo-B at the end of December because my vitamin B12 was in the higher end of normal and it's been normal. So I got you. Send me a message. Because if you don't message me, I'm not going to remember, Phoenix. So send me a message and I'll send you the link. Good morning. So I've been taking Lipo-C ever since. Lipo-C. I get my Lipo-C from In Bold Telehealth from Dr. Marshall. So I've been using it since 2023 consistently. The things that I use consistently on my journey, of course, is my GLP-1, my Lipo-C, now my glutathione. Hey, Royale, thank you. It fell. I had used them. That's the only thing I hate about them heatless curlers. Like, it don't last. It looks good for the first 30 minutes and then it falls. So my glutathione, please, y'all stop asking me like how I reconstitute it. It comes from Amble Telehealth. I don't reconstitute it. I'm on the vial from Gale because I just used my vial from Amble, but mine's on auto review. I get mine also from Gale. I don't reconstitute my glutathione. It comes now. If I have to, yes, I would. I do not reconstitute it. That's the biggest question that I get asked. Or what's your dosage? My dosage is for me because I get it from my doctor. I can't, and I'm not going to tell you my dosage and you try it, then it don't work for you, then you come back and you want to blame me. And nah, we're not doing that. Do you take, no, I take my glutathione at night, like right before I go to bed. So if I go to bed at 9 o'clock, I take it like about 7:30. How do you keep up? How do I keep up with what? All my stuff? Just memorization. When you are in a routine, you just like getting up in the morning, using the bathroom, brushing your teeth. That's just how I remember what I need to take. I'm just going to be honest. Consistency is key. A lot of people are not consistent. If they don't see instant results, then they think it's not working for them. And that's not true, especially with glutathione. Like I said in my video, and I stand by that, you can do glutathione, but if you're not drinking your water and if you're not having a skincare, you're defeating the purpose of taking glutathione or injecting it. You have to have a skincare routine. You can't expect a glow with some dull skin. You can't expect a glow if you're not taking care of your skin externally. I needed to fix a lot of stuff internally. So that is the reason why I take the things that I take. You reminder, I just remember. I just know that if I don't take my V8 in the mornings, it's going to be a bad morning. I don't like going to work negative. I don't like sitting up there. I just don't like negativity. I don't like feeling anxious. So my V8 helps me with that. My V8 helps me stay in a positive mood, which reflect when I am rooming patients. So that V8 stack right there. Yeah, the pens help these pens help with fatigue. I'm telling you. I take my glutathione because I notice my skin. I take my GHKCU topically, as well as internally because it's done for me. I wear extensions, so I can't put the serum like, you know what I'm saying? So I take it internally. What is V8? So I call it my V8 because my 5 amino acid, C-Max, Langmoxie, and NAD looks orange. So Kat was like, girl, that's that V8. So I call it V8 because of the color. So I take my NAD. I take NAD as well. Hello, Bad Mulatto. Welcome in, sir. How are you doing? How are you doing, sir? Mm-hmm. That's my ex-boyfriend from high school, y'all. He had dumped me. But y'all can follow him now. No, we're good friends. We're good friends. I joke about it, but we're good friends. I got put out the house because of him. True story. Okay. I thought we was going to have babies together, but we didn't. Okay. But I did get put out the house. But Baba had my clothes outside the door. Okay. I'm afraid about the pens. Can you touch on them? Yes. So, yes. Y'all can go look at him. He's cute. He's a little cute. However, he didn't go with me to my senior prom and we broke up. So, the pen... So with the pens, these are V2 pens. Didn't realize he might work until I skip. Yes, baby, if you skip, you will have a bad day. So these pens, ma'am, these pens are quick pens. So if you have used Oz or Wegovy, these pens simulate that. You can dial up your dosage on this. So it comes with cartridges. These are the cartridges that you have to fill with your treatment. And once you fill them, and I have the video on my YouTube courtesy of Kat, then you put it in here. And then you use your insulin needle. You will put your insulin. I will do a video. But these pens helped him with pen fatigue. No, baby, let me Kat. I did. And somebody be like, ooh, she telling all her business. I'm grown. My mama might be in here. My mama will tell you I wanted to eat, you know, and I stayed out, and my mama had my clothes at the door, and I had to beg my mama to let me back in, and she let me back in the house. She was like, next time I tell you to come home, you come home. Okay? My curfew was 1:00. I got home 7:30 that morning. Y'all, Joyce had played with me. You just say, okay. You were late, girl. I was late. I was late. I tried to call her on the phone. She hung up on me. Yes. Honey, my mama did not play with me. Okay? I need somebody to set it up for me. What, the pins? The pins is easy. I promise you. You do it one time, they're really easy. Girl, my mama didn't play. My mama threw a Reebok shoe at me. My mama done beat me with a roll of toilet paper in the middle of the store because she said, don't ask for nothing. So, yes. One thing about me, I'm going to be honest, always open and honest on my platform. I'm gonna be, why would I lie to y'all? I have no reason to lie to y'all. But then some people treat me like I'm a liar. I've been open about everything. I've had somebody ask me, and I was telling Kat this the other day, how can you put your life, you can put anything in these pens. If you don't feel like using the traditional syringe, you can put anything in these pens. Side note, who's going to the meetup? I will be at the meetup. Kat will be at the meetup. I think Danielle was in here. She's going to be at the meetup. So yes, you can put anything. Even if you have your compound, long as you load it in this cartridge and you put it in here, you can dial it up, and that's how you can put anything as long as you fill this cartridge. I'm going to ATL. I got to see about Dallas. So yes, I'm sorry. I'm just now getting to the live. So the meetup is in Atlanta. Somebody can put the dates in Atlanta, and they have one in Texas. So I'm just focused right now on the one in Atlanta. I will be there. Today I got my computer. I will be looking for an Airbnb. Will I be going to the one in Dallas? Absolutely. I will be going to the one in Dallas as well because I want to see Delonte, Mama Glenda, and I definitely want to meet up with Gail. So I don't know the dates. I think it's the 20-something, the third weekend in June. There you go. Somebody help me out. The third weekend in June in Atlanta. So I will be there. I already got my meetup here. After this, I got my meetup here. So yes, ma'am, you are looking younger and younger. Thank you. Thank you, Nebby. I'm anxious to see y'all. Staying in home 2 suites. I need where me and Kat can stay together. So if I can't, and I'm gonna use AARP, honey. Okay, you ain't got to be old to use AARP. So I'm going to I would like to see you. I'm going, when you meet me, don't think that when you meet me, I'm kind of standoffish. And it's not me, I've been through so much in this community. I have to feel people out. I'm going to be honest with you. So do I have a good time? Yes. Will I hype you up? Yes. All of the things. So for me, I just have to stand and watch you because a lot of people, like I've been through a lot. Some of the stuff I provoked, I own my own part. Some of it I have not. So I am very careful on who I hug and exchange energy with. Some creators is going to be there. It's going to be good. Some creators that's going to be there that I don't care for, I'm just going to keep my distance. They don't say nothing to me. I don't say nothing to them. That's just the type of person that I am. And I'm not going in negative. I'm not going in with no ill will feelings. If you know you don't F with me and I don't F with you, just keep it like that. Don't even tell me hi. Let's just keep it real and just keep it moving. That's how I am in real life. Real talk. So I'm going positive. I'm going with a sip or two. I'm ready to have fun outside of the meetup. You know, I'm going to get with my girls. We're going to do some things there. Already got a couple places that I want to share. You know, hanging out with my friends, and it's that's just where it's at. Like Kat, I'll meet her for the first time, and we're besties. You know, when I get to see Delante, besties, like everybody that I associate with. And do you have any March goals? Oh, my March goal, honestly, is I'm not gonna lie, just to continue with my skincare. My March goal is to, I'm not even gonna say be healthier, but my March goals I'm not gonna. No, I don't have any. I'm not even gonna sit here and make no any lie. I don't have any. My March goals is just to just take it day by day. My March goals is to wake up being in a positive attitude, have a positive attitude, and being in a positive space. That is my March goals because, and I'm gonna tell you why. Outside of this GLP-1 community, it's a lot going on in the world, and I have a son right now who's currently enlisted in the United States Army. So I'm trying not to worry. I'm worried about him. I'm just worried about the state of America right now. So I just try to live in the moment and I just try to be in a positive space. Walking my dogs right now. Oh, awesome. So I'm just going to keep it real in the book. March, I just want to that's be in a positive space. That's it. I love the GLP-1 community. I love the people in the community. Sometimes people get on here and argue about the tedious stuff when we have more stuff to worry about. And I'm just going to keep it real in the buck with you. If you don't want to be in here because you feel like it's too politics, I'm just going to keep it real with you. There is no need to sit here and talk about GLP-1s and arguing when a lot of us have targets on our backs. Okay? So yeah, I'm just trying to, that's where my C-Max and Solange come in at. The stuff that I deal with on a daily basis, you will be shocked. So I have to maintain my mentality. So with being more positive and showing up more. That's it. Y'all wouldn't even know. I don't even look like what I went through. Y'all don't know y'all, it's a lot mentally. And I try not to trauma dump with anybody. I try to trauma dump in prayer. And that's the message that I can leave with you guys today. There's nothing, and y'all know I used to tussle with people on this internet. Y'all know I would get down, gritty, dirty with people on this internet. Nobody is worth in this community arguing about a bunch of peptides, where you get it from, how you get it, PAs, who wants to be the GLP-1 guru. There is no GLP-1 guru. There is no, listen to me, I am this, I am that. You can put a title on it. And the reason why I say that is because your journey is your journey. That's just it. Your journey is your journey. There is no GLP-1 guru. If y'all are paying for a handbook, you are wasting your time. You have to learn your body. I still can read now. I'll give a good read. Your journey is your journey. What works, that goes back what works for me. People might not like that I eat out a lot. That's your business. I am maintaining happily in my maintenance journey. And then the people who are hating, y'all are not even in maintenance. Y'all still losing. And then y'all still losing. BJ, boy, I had to apologize to my baby. The OGs and I don't consider myself an OG, Leah. Thank you. Because I started September. You have to be positive. What is that? What is it that you use for your, again, which Cartier? You missing the word, baby. Is it Carter or Cartier? Because I'm just giving you a whole fancy name, baby. Concentrate on yourself. It's just too much. Oh. I don't know. I haven't put anything on my hair. I'm gonna be honest with you. I use that little band and my curls lasted all of 30 seconds. But I don't, when my beautician curl it, I love it, but I love like a loose curl with layers. So yes. Oh, Baskin leather. Oh, okay. I use Baskin leather, oil stimulator, scalp stimulator, and elixir on my hair. Like I had no edges, y'all. Look at that. I had no edges. And GHKCU, you can, or someone takes GHAC, whatever, KCU. I got you, KG. So those used consistently, your hair will grow. But I see so many people. Let me tell you, you could take prenatal pills. If you don't want to do the peptide route, just get you some prenatal pills. If you are shedding on a GLP-1, and I am a licensed cosmetologist, if you are shedding on a GLP-1, make sure your hair is not in the hair shedding phase, because your hair does go through a phase. Your follicles, you do go through a hair shedding phase. That could last for weeks. It could last for months. That's your hair getting rid of the old dead hair. I'm gonna be real, anything that comes out of the hair follicle anyway is dead. However, you want to take care of what comes out of your scalp. GHKCU, if you want to internally, and drops. It will. Somebody asked me another question. Hold on. Baskin leather. I'm sorry. Does anyone take AOD? That's a good question. If someone does, they can answer that for you, because I don't. GHKCU, and I always show what my progress is on that. And then for my lips, it's a ColourPop lip liner that I use, and I use that new e.l.f. lip plumper that I got from Ulta. So yes, it's like a light pink. So yeah, I want to plump my lips. I want my lips to be juicy. You're welcome. You're welcome. And then my makeup is laying down because of my skincare and the GHKCU. I'm loving it. I had to do a little highlight for y'all so y'all can see the bling, and the blinging. But the GHKCU took my hair. Like I actually grew a lot of hair. I am noticing hair growth on my face from the GH, a little bit more fuzz. I'm not gonna lie to you. I noticed it right here as well. So, but like I said, it's helping with, I had no edges, y'all. And this may not be a lot to anybody. All this was bald. And I just used consistently Baskin leather, GHKCU. That's it. And drink my water. Water. Like I got my baby water now. All that's all your haul. So the color corrector, I'm learning how to, I have so much content, I'm just afraid to put it out because I feel like nobody's going to like it because everybody's so used to me doing GLP-1s. Somebody asked me, you don't even talk about prior authorizations no more. And I said, I don't, because I get tired of doing videos and people coming for me, and I'm just not telling you specific insurance company. I'm just telling you overall. That gets tiring. I'm going to be honest, that gets tiring for me. Are you considering fillers? No, I'm not. Only filler, if I can afford it, is underneath my eyes, but my eyes are not hollow. My eyes are just genetic. That's it. I've always had dark circles. So thank you. So I follow this one Indian lady. She has dark circles and she's not on the GLP-1. And guess what? I'm just going to live with them. And then I'm just going to flip it, sis. I'm just going to flip it, sis, into a brand deal. You still got to put it out. Take time for the algorithm. Yeah, it's not even the algorithm. It's just, I love helping people through their journey. I will always help people through their journey. I will always help you with a prior authorization. I will always help you with an appeal. I will always help you with diagnosis, right? Because everything is like changing. You know what I mean? So I love dropping news, but I am not that invested to, for example, I see people, oh, Lily, da 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 da. Okay, I get that. Dropping for assets. If the price does not change, it pisses me off. Like these quick pens, it pisses me off. I'm not gonna lie to you. Novo Nordisk, even though they dropped the prices for Oz and Wegovy for next year, not this year, but for 2027. So what that's gonna do for people now? If it's not accessible or affordable, it pisses me off. That's it. That's all I need for Lily them to do. Then you have Compound. I love Compound. Would I love for everyone to sign up with LifeRx? Yes. We don't offer everything that people want. So I'm going to steer you in the direction of what you want. But I will always talk about prior authorizations, diagnosis codes. I will talk about all of those things because you have people that's not in the medical field or don't do prior authorizations tell you stuff and it's not true. You have people that talk about sleep apnea. Oh, do this for sleep apnea. If you do not have the diagnosis of obesity, you're not going to get approved for sleep apnea. You're just not. Then you have to make sure that it's covered. I tried to explain coverage. I tried to explain, all right, Destiny. Ah, look at that. For real? Girl, you gonna make me tear up. Congratulations. Congratulations. I'm excited for you. I will walk you step by step for the process. If I can't help you, I will guide you in the directions of someone that can help you. My platform is about safe accessibility and affordability. You have people that want to do peppers. I don't care if you do peppers. You have to get them tested. If you don't get them tested, I saw a video. This girl was like, now a lot of people are ending up in the hospital of doing peppers. I'm going to tell you the reason why. It's not only not getting it tested, is because people come out here, they see people talk about the triple OG. Okay, Rita, you get on Rita, you've never been on Rita. There's not even enough clinical data on retatrutide. You are going off of what people are saying about their personal experience. So therefore, and I'm going to be honest with you, they're going to make retatrutide a biological. So that means that you will not be able to get it. So it's going to be hard to get and you can't compound that. So I'm just going to be, that's the gem. Okay. So if you're doing that, I need for you to be careful. I need for you, if you have people who's never, ever talked to a doctor on GLP-1s and y'all ask these influencers. And then the first thing you do, if you get sick or something, they're going to make a video talking about, yes, I see people on here and they're doing this and they're asking me this. I am not a medical field and I don't represent, but you're giving out medical advice and you're telling people dosages. I'm going to say this one time and one time only. There is this thing called malfeasance and malpractice. You do not have to be in the medical field to be charged or hit with malfeasance and malpractice. Do you know why Lily offers the pen if you have insurance coverage? No, I don't. I'm not going to lie to you. I don't. That would be an Eli Lilly question. I just think, why get the vials? Okay, so let's give you the history of the vials. Y'all can hate me. You can tag me. Some of y'all gonna be messy. I don't care. A lot of people came on here, hashtag release the vials. Okay? Release the vials, release the vials, release the vials. So Lily did that so people could use Compound less. Because right now, Compound is taking money out of Lily's and Novo Nordisk pockets. Let's just keep it a real and a buck. So everybody kept going on with this hashtag the vials, because they claim at that time the shortage, and the reason why it's a shortage is because of the pens. Okay. But a lot of people do not realize those pens are not only for MJ and Zepbound. They use it for Trulicity and they use it for Taltz. Taltz is an injectable medication for rheumatoid arthritis. Those pens actually are for people who have severe arthritis. It's easier for them to unlock, and that's the whole reason for the pens. If you have thank you. That's the reason. Okay, that's coming from being in rheumatology. If you have some type of rheumatoid arthritis, if you notice a lot of rheumatoid arthritis, right, a lot of the pens, they come in pen form. Okay, so that is the reason for the pens. So when people were talking about the vials, they were like, okay, well, we're going to have the vials for Zepbound and you can get it. So they gave the people what they want, but y'all didn't say y'all wanted to be affordable. All y'all said was release the vials. And that's what they did. See, when you pray, my mama said, when you pray to God, you got to be specific. See, when y'all asking these companies to do something, you need to be specific. And y'all listen to release the vials. And now you complaining that the vials are expensive. But y'all didn't ask them to make it affordable. They gave y'all what y'all asked for. So they're not going to make the pens, the vials for Mounjaro when the pens work. The vials was a commercial gimmick and it worked. But Lilly at that time said instead of getting it through CVS, so you will make sure that it's not a shortage, you can get it through us. So that's why they made the vials. They came up with the quick pens because a lot of people were complaining about the vials. The quick pens are the same thing. It's just one dose. And it helps people dial up their dose. And I think and honestly, it's helping people who's getting 15 milligrams and they breaking down that vial to 5 milligrams. Let's just be honest. So that's the reason why they came up with the quick pens. I've been doing this for so long. I can tell you the trends. I can tell you the reason why things are being done. I just don't speak on it because I get tired of being attacked. You're finally able to get on Compound in January. I'm happy. Okay, you Jay. Congratulations. And yes, for me, I do reach my full of being attacked. So that is the reason why they're doing it. You can now, some insurances now like DivaNet are getting the quick pens from overseas because it's cheaper for manufacturing purposes to get it. So I've known 3 people who's getting the quick pens and they get their medications from the UK. Go figure. I don't know. So that is the reason why. I think any of them is good. I think Compound is good. I'm going to tell you, be an advocate. Have an A, B, and C plan. All those people over there, if you're getting peppers, still have an A, B, C plan. I'm just going to tell you because eventually they're going to crack down. They're cracking down on it. I'm in a couple group buys and one of them always get confiscated. Always. A lot of people like to do their unboxing and tell who they got it from. Yeah, no, I'm not doing that. And when I've shown my vials, but I would never do an unboxing and I would never tell you who I got it from because that's just me. You can call me gatekeeping, you can call me whatever. I'm not going to tell you where I get them from because of the fact that, yeah, but it's a lot of stuff that's going on. Just be quiet about it. But like I said, if you're giving medical advice and you're telling people what to do, and they get sick, and then when they come back and tell you that they get sick, you can't say I didn't tell you. You can say no medical advice given if you still told them to take a certain dosage. That's why I ignore people when they ask me about my dosage. You can be hit with malfeasance and malpractice. They're not playing on this new version of TikTok and this new this version right here. So yes, so I don't give nobody. Now I'll talk about my dosage. Like I tell people 7.5 is for me. Okay. I'll talk about I will never tell you my dosage of glutathione because that is coming from my doctor. My doctor, my doctor, do you hear me? My doctor, even doing GHKCU, I tell my doctor tells me what dosage to do. My doctor, my CMAX and Solank, I calculated it myself. So that is on me. But my NAD comes from a script that's from me. So a lot of people don't want to hear that. These lurkers be reporting when people just be trying to help. So yes, you're exactly right. Been on Compound 3 years, just used to it. Yes. Did you see the video I sent you? The girl that is reconstituting peppers for sale. I saw that. And a lot of people will use the excuse of I can do that. A lot of people, a lot of people they get mad. They want to read, but they want to read. Yeah, it's not illegal. Da 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 da. That's just like me having Adderall, right? And I get Adderall and I sell it to you. It's illegal. If you're getting something and you're purchasing it, it's for the purpose of you using it. If someone buys something from you And that's not talked about, and it's not fear mongering, it's the truth. If someone buys something from you and they use it and they get sick, that's just like a street pharmacist. That is it. Just keep it real. It's like being a street. Those who know what a street pharmacist is know what I'm talking about. That's just like a street pharmacist right now selling you some endo. Y'all know what I'm talking about. Selling you some green stuff. That's illegal. You just went. It's illegal. Everybody want to make a come up. I don't knock anybody hustle. But I tell you what, I will move. It's only one girl on here, and I'm not even going to mention her name, but I love her. She's a creator. I follow her. She follow me. I love her because she speaks in codes. Okay? When you order from her, it's in codes. It's in code. And I can respect that. I don't knock anybody hustle at all. Everybody out here trying to unbig their back. I get that. But however, come on. If y'all don't think that the FDA is not watching, keep thinking that everybody y'all thinking y'all inbox purchasing from y'all is a legit person. Keep thinking that. Keep thinking that some of these people are not out here snitching. Ask me if I had any extra shot I can sell. Right. No. Sapphire, right. They used to hit me up. They used to hit me up and I cuss them out. I used to have people ask me, can they buy boxes of my Monjero? No, because what I'm gonna charge you, you might as well go on. If I were to sell it, which I'm not, but if I was deep down and dirty and wanted to sell my boxes, guess what? You might as well go on and get compound because you're gonna pay me. I've been on GLP for 2 years. Went from I'm stuck, can't lose anymore. So revisit. What are you eating? Are you moving your body? I'm not saying work. Are you moving your body? How's your water? I was like, hell nah. I ain't right. I'm just saying. My favorite is the woman that says she's pregnant, can't take it. Listen, that bot be in everybody's. All need movement. Awesome. If you need improvement, well, Brittany, reach out to me and let's go through the steps to see what's going on. Because sometimes you might just need to get them extra calories in. I told my friend that I love my friend, and she's not eating enough. That's why she's not losing. She said she had 2 boiled eggs and a toast. I said, girl, what is that supposed to do for you? So reach out to me. My friend, right. Sis, that bot be all over the place. All over the place. I'm in the same boat, can't lose anymore. What are you guys? So tell me what you guys are doing right now. Tell me in a day what you typically eat. Is a stall natural? Yes. Your stall is basically, I hate the word stall, like plateau, but plateau and stall are the same thing. So when you are hitting a stall, it is your body's way of protecting itself against itself. It's saying, hey, I don't know what's going on. This is where we used to be. This is where we're safe. This is where we're comfortable. So we're just going to hold you right here. And you're trying to get down, but your body's like, no, this is where you need to be. This is right here. Like, you know what I'm saying? So I'm not going to say fight against your body. So increase your calories to your set point. Thank you, sis. You need to trick your body by adding more calories. A lot of people think you need to add more calories so your body can burn. It's tricking your body into burning. I'm on the last dose. Last dose like forever or last dose of what like forever? That's a last dose forever, ever, or the last dose of a certain dose. I thought I was in a stall, but increased movement actually. Right, highest dose. So you went up and okay. So I'm not going to tell you to reset. I'm just going to say revisit what you are doing. and went down in dose and started losing again. You can do that too. Yes, I noticed the more I started. Let me tell you something. KG, thank you. People sit up here and come for me and my chicken and waffles. Baby, when I found out, and I did on my first page, Monjero 843 Queen. That is my first page. You can track my journey there, from beginning to end. When I did a video on decreasing your protein shakes and eating more, and the more you eat, the more you lose, people was coming for me. Now everybody, oh yeah, the more you eat, the more you lose. Duh, I've been told y'all that. But if revisit, increase your calories. And increase your please don't ask me where you should be. I don't know, because I don't track my calories. For me, I don't track my calories. For me, I don't track my protein. For me, only thing I track is my water, to make sure that I'm going to the bathroom every 30 minutes, making sure my kidneys are good. Because the medication puts me in a calorie deficit. When it comes to protein, I don't have a problem getting my protein in, and I don't do it by a protein shake either. Well, every morning I have my protein coffee, but I don't do it. Thank you. I track my protein on an app. Okay, Tina, outside of protein, what are you eat, like caloric? What are you getting in caloric? She says, okay to eat a full balanced meal. Not. Thank you, Sapphire. Thank you. I'm going to get off, because speaking of balanced meal, I need to get something to eat, and then I need to fix something for dinner. 1,300 calories. Did you adjust your caloric intake as you lose? Meaning every 10 to 15 pounds, did you adjust? You need to readjust your caloric intake at the weight that you are now. But for Yolanda, I don't even know what's for dinner, girl. We done had everything. I got them salmon that I got last week. I might do that in a mango pineapple salsa over that. Yep, it's one now. What's your favorite meal? I don't know. I've been to Whole Foods, but I haven't really looked. So I'm gonna go on there and look and see what they have as far as taking stuff for lunch to work, cause I'm getting tired of Arby's. I'm getting tired of Culver's. Culver's got the best chili, but I'm getting tired. So yeah. And I definitely don't. I only eat McDonald's when I'm constipated. I see a doctor and he adjusted calories, it seems, about every month. So you don't do that every month. Do it to every 10 to 15 pounds that you lose, and you stay there. Girl, I can't do lip. Yeah, Chick-fil-A. I only eat their salad and chicken nuggets. I don't eat anything else from Chick-fil-A. And that's before GLP-1. Like you took me to a good Mexican restaurant with some shrimp tacos, then we're talking with some cilantro. Cause baby, that's what I really kind of want to. I really kind of want to. I might do that. I might make some shrimp tacos tonight. Ooh, give me some cilantro. I think I'm gonna do that. I'm about to make some shrimp tacos tonight. Yeah. Hey, girl, yes. With some cilantro. Ooh, yeah, we having shrimp tacos tonight. I may copy. You want it, Royale? Hey, I'm gonna be honest. Whatever y'all, hey, I'm just here to help. But I think I'm gonna make some shrimp tacos. Ooh, and then I could put as much shrimp as I want in my tacos instead of they be giving you 3 little funky little shrimp. Oh yeah. Any more questions? Because I know it's Sunday. A lot of people probably hopping off. Somebody else probably is live. I don't want to occupy all you guys' time. Make sure you. Thank you. And I'm going to upload that live to my. Yeah. almost said the word. So my YT, yes, I thought I would just be me. I'd be like, let me get some, girl, they be giving you what 3 little shrimp gonna do for you? Give me like 5 to 6. I need about 5 to 6 shrimp. You know what I'm saying? So yes, nobody don't play around with that. So thank you guys. Remember, it's a new month, new goals, new attitude, positivity. You guys got this. I need about 6, girl. I need about 6, Royal. Thank you, girl, Royal. That's why we cool, sis. Cause you understand the struggle. I have videos loading, so I'll do those. Thank you so much for tuning in. We got to bring back Dr. Angelina. We can discuss more stuff. So I hope you guys have a wonderful Sunday. Vitamin C or Fat Blaster, which one is recommended, Kim? Need a good vitamin C is a fat burner. Vitamin C I use to help with my skin and immunity, to build immunity. A good Fat Blaster, for me that I use Lipo C. I do have L-carnitine and LipoLab. Those are the only 3 things that I use. And if you use it consistently, you won't have to add. Y'all hear my stomach? My stomach is speaking in tongues, y'all. Did y'all? I know y'all heard that. I know y'all heard that, right? Can I buy from you? No, I don't sell Lipo C or the company that I'm with, Lipo C. Hey, I know. I'm following back. Girl, I got to go. Do y'all not hear my stomach? And I'm not even sleeping. Listen, Linda. You got them lights on. I'll show you a dog. I'll show you a video on how to do it. It's real easy. Y'all, ooh, I love y'all. Let me go get something to eat. Y'all have a good day, because that's embarrassing. Okay, if you have any questions, please feel free to message me. You guys have a good Sunday. I'm going to get something to eat. Bye.